간다이 만두나 야기 도루이루가 para y honra, para y gloria, aviva y islacen para y honra, para y gloria, aviva y islacen para Gitodu y tempu y paz para ita dan gini langit na bendición contra y peligro na fan sa fuham Deus protegis languam contra y peligro na fan sa fuham Deus protegis languam.
From USA is where I come from, and that's where I ought to be. Enjoying the girls along on the beach and under the coconut tree. Warm is good, warm is hot, warm is just such a little spot. It's a beautiful island that you've never seen, where America's day begins.
Oh, yeah. Let me just tell you, you guys know we mean business when we start the show with this song. Good morning, Guam. And thank you. We were just doing our imitation of one of the governor's press conferences, you know, at 6 a.m. and going 25 minutes later. It's Thursday, the 16th day of April. Containing COVID, it is the KUAM News Takeover of Guam's favorite, I-94. Good morning on you, Facebook Live.
Hafide.
So many ways to get the show. Of course, KUAM News, the Facebook Live feed. You know, if you can, watch it, share it. We got a lot of guests, a lot of information on for you guys coming up. Also, we're streaming live on the KUAM News app and at KUAM.com. The audio stream, Docomo Channel 10. And then 8 o'clock, we go on to KUAM TV 11 for the last half of the show, where we have got some guests lined up for you guys this morning. We're going to get Daphne Shimizu from Rev & Tax to find out about these advance payments and the status of the stimulus checks, because right now everybody on Guam is like, Par, can I borrow until I get my stimulus?
And this supposed to be coming out, right?
It's supposed to,
today or tomorrow?
Well, for the advance payments, right? For those who earn under $10,000 a year.
That's
so we're
for tax year 2018.
Right. And then, so the regular stimulus, which is the $1,200 one, that's the one that we're going to try and ask Daphne about. But, you know, in talking to her, she has worked hard. We talked to her a couple weeks ago. She said she was already getting all the stuff ready. So really excited to find out where she's at with that this morning. It's 6:27. It is containing COVID, and as we always do, we start the day with a deep dive into COVID-19 news on Guam from the KUAM News team. Sabrina Salas Matanati. Good morning, Sabrina.
Hafide, good morning, everyone. The latest from the Joint Information Center, released at 9:45 p.m. last night. Public Health tested 19 individuals for COVID-19 on Wednesday. 0 tested positive through Public Health and 19 tested negative. Now, Guam Memorial Hospital, it has testing capabilities now. GMH tested 13 individuals on Wednesday. 0 tested positive through the hospital and 13 tested negative. To date, there are a total of 135 confirmed cases of COVID-19 on Guam, with 5 deaths and 73 recoveries. Recovery means a patient is no longer considered infectious. According to CDC research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All 57 remaining cases are in isolation. The governor's chief medical advisor says the South Korean rapid test kits being used in the CNMI are not FDA approved. Dr. Michael Cruz is not recommending use locally to increase testing capabilities. His comments were in response to a letter written by Speaker Tina Munoz Barnes on Tuesday, raising the possibility of using those same test kits in the CNMI on Guam. During yesterday's media briefing at Adelup, Dr. Felix Cabrera read the response letter by Dr. Cruz.
So dated April 15, 2020, Honorable Tina Munoz Barnes, Speaker, Imina Junta, Singput, Dalit Session, Aguacan, Guam Congress Building, Sagana, Guam. Dear Madam Speaker, Governor Lou Leonguero's Physician Advisory Group is in receipt of your letter dated April 14 regarding the potential use of South Korean test kits for COVID-19 confirmation. While it is clear that mass testing is essential to combating this virus, that testing must be safe, accurate, and reliable. Unfortunately, as recently as yesterday afternoon, my conversations with the U.S. Food and Drug Administration indicate that specific test kits alluded to in your letter have not yet received FDA approval or an emergency use authorization. This is despite the fact that some international media have said the exact opposite. To be clear, this does not mean that your suggestion is without value. The kits referred to in your letter can be used to determine COVID-19 infections on a presumptive basis. This simply means that results, both positive and negative, will have to be confirmed by another testing meeting FDA and CDC standards. Given the national shortage of test kits, some U.S. jurisdictions may be willing to adopt protocols that deviate from the standard of care. But that is not the direction dictated by our present circumstances. Pending additional guidance from the FDA and CDC, we must understand that through more testing should be done, unreliable test results can become even more dangerous than no testing at all. Because even one COVID-19 positive patient can be an unwitting weapon against our entire community, I fully appreciate your desire to rapidly develop our testing capacity. This is why we work to obtain rapid ID test kits and equipment from Abbott Laboratories. Guam has received a commitment of 200 Abbott ID Now test kits a week, which can obtain results within minutes. Additionally, these kits have received emergency use authorization by the FDA. As a physician and former Lieutenant Governor of Guam, I understand the immense challenge faced by island leaders today. Please note that I and other physicians actively review testing and treatment innovations of COVID-19 throughout the world. If tests like the one that you have mentioned can return a credible result, one that is accepted by the FDA and CDC, I will have no problem recommending their use. Our advisory group also understands that both science and technology behind COVID-19 testing is rapidly developing. For this reason, we are preparing to outline protocols for the adoption of new tests. Until then, should you have any information demonstrating that this foreign test has been approved by the FDA and CDC, please feel free to share with
Cabrera. He is with the governor's medical advisory group, reading a letter by the chief of that group, Dr. Mike Cruz, in response to Speaker Tina Munoz Barnes. Again, although the South Korea test kits aren't an option for Guam, Dr. Cruz announced that we have received a commitment of at least 200 weekly rapid ID test kits, along with equipment from Abbott Laboratories that are FDA approved. Meanwhile, Governor Lou Leonguero also during the media briefing stressed why we are not using test kits from South Korea, like the ones that are being used in the CNMI.
In healthcare, it's a very sensitive, I think, service to deliver to our people because it can mean life or death. So there are standards placed, there are best practices placed, there are guidelines placed, there are validations placed. There's a lot of scrutiny and there's a lot of protection and there's a lot of regulation. So to assure the public that whatever procedures, whatever equipment, whatever treatment we provide for our very, very essential and crucial community, that they are based on standards and they are approved by entities who monitor and regulate those procedures and treatment and equipment. So these tests that are coming in have to go through that same scrutiny. And so, as governor responsible for the safety of our island and the health of our island, I am very much determined that we have to abide by the rules, the regulations, the standards. These test kits are not FDA approved. They're not even EUA approved. And so I don't want to risk to our community the possibility of these tests being not effective, being not accurate, being not reliable. Because what that means is if this test gives you a negative and you're really a positive, and the test says you're negative and you rely on this test, that gives you a sense of false security. That gives you a sense of false positive and false negative. So a false negative person may think, oh, I don't have COVID-19, but they really do. And as a result of that, they may think, oh, I don't have to wash my hands anymore. I don't have to isolate myself anymore. That's the risk and the consequences of allowing non-effective
60,000 COVID-19 rapid test kits have been acquired for the Northern Marianas. Hospital CEO there, Esther Muña, says they expect to be ready for community testing in about 2 weeks. Muña clarifying that these test kits from Asia are not approved by the U.S. FDA, but have gotten the green light by its equivalent in South Korea. She says they have a high accuracy and are the same kits ordered by some cities across America. As the entire country competes for supplies, Muñoz says it's not likely that the islands will get 60,000 test kits for the U.S. FDA equipment already on site. A South Korean pathologist is on Saipan to train staff on how to use the equipment and conduct quality checks. You can watch the full interview with the CEO with Saipan correspondent Tomas Manglonia. It is streaming on our Facebook and YouTube channels. Also from the CNMI, the governor there has renewed his declaration of state of public health emergency and a continued declaration of state of a significant emergency for 1 month. As for an update on session, lawmakers, they are expected to go into session at 3 o'clock where they are anticipated to vote on Bill 335. And again, that bill deals with establishing a curfew for all on Guam. An update on the USS Theodore Roosevelt. As of today, 94% of the USS Theodore Roosevelt crew members have been tested for COVID-19, with 615 positive and 3,958 negative results. 4,046 sailors have moved ashore. 5 sailors assigned to the Roosevelt are in U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors is in the intensive care unit for increased observation due to shortness of breath. In national news, more than 26,000 Americans have now died from coronavirus. The toll went up by more than 2,300 people from yesterday. The numbers in New York have stabilized with deaths in the 700 range, but the state now has more reported cases of COVID than any other nation in the world. Michael George has the latest.
Nurses from around the country got a hero's welcome when they arrived at a Long Island hospital Tuesday. Their hospital system that services much of the New York City area put out an SOS for help, and 46 nurses answered the call.
I just feel like this is a calling that I felt several weeks ago. I left family, kids, grandchildren behind to come up and help these people that need our help.
Health officials in New York City are changing the way they count coronavirus deaths. They added 3,800 people who never tested positive but are presumed to have died from COVID-19. New York's governor today mandated mouth and nose coverings for all residents when they're in situations where they can't keep a 6-foot social distance.
Local government should start to enforce it.
In Richmond, Virginia, Canterbury Rehabilitation and Healthcare Center has now lost 45 residents. That's more than the number of COVID deaths at the Life Care Center in Washington State, where the crisis in this country started. In South Dakota, a city mayor is pushing back against the state governor, who has not issued a stay-at-home order. Sioux Falls is the site of the largest known cluster of coronavirus cases in the country. 440 employees of this now closed pork processing plant.
Well, right now we're doubling, and we've been doubling every 4 days for the last 18 days.
I would rather be chastised for being overcautious than chastised for saying, why didn't you act, Mayor?
But dozens of protesters in Michigan say their stay-at-home order has gone too far. Today they surrounded the state capitol and blocked traffic.
We're tired of not being able to buy the things that we need, go to the hairdressers, get our hair done. It's time to open up.
Michigan has lost 1,700 residents to coronavirus, and the governor says to save lives, she extended a stay-at-home order through the end of the month. Michael George, CBS News, New York.
As one of the reporting process, the Guam Department of Labor is requiring all employers and business owners who have displaced workers due to COVID-19 to register and email their business or contractor's license to vos@dol.guam.gov for verification purposes on the department's virtual one-stop system, HireGuam.com. The department is now announcing its plans for Phase 2. GDOL is actively working on a brand new module that is currently being installed. In approximately 2 weeks, employers and business owners can start to report employee information who have been furloughed and laid off or have reduced hours caused by COVID-19. Phase 2 is mandatory so that those displaced workers can avail of the Pandemic Unemployment Assistance Program, or PUA, along with the Federal Pandemic Unemployment Compensation. GDOL will announce when Phase 2 is enacted once the module is fully installed. Also from the Joint Information Center, U.S. Air Force engineers assigned to the 554th Red Horse Squadron are constructing an Expeditionary Medical Support System, or EMEDS, which will consist of 3 25-bed capacity units within the fence line of U.S. Naval Hospital Guam. This project is expected to be completed within the week. The extra beds and additional staff of 90 Air Force personnel will provide expanded capacity for Naval Hospital Guam, allowing an expansion from 42 beds to 85 beds and from a 6-bed ICU to 24 beds. The project will not only support efforts to get the crew of the Theodore Roosevelt healthy and back out to sea, but will also give expanded ability to add to the government of Guam's medical capacity. Seabees assigned to the Construction Battalion Maintenance Unit 3 are in the process of constructing an Expeditionary Medical Facility, or EMF, on DoD property in South Venegodson. This is a larger construction project, will result in a 150-bed capacity field hospital operated by over 400 personnel. With material offloaded from Naval Base Guam and site preparation already in progress, the project is to be completed in approximately 2 weeks. Now, the EMF will provide expanded medical capabilities in support of DoD's COVID-19 response. DoD will be postured and well equipped to support the greater Guam community and the region if a defense support of civil authorities mission is requested in Guam. And finally, Payless Markets, a division of PMC Investment, donated $12,000 to the Guam Medical Association for PPE supplies, which will be used by frontline healthcare workers to protect them from COVID-19.
All right, and from the GMA, let's get Dr. Tom Shea on, and hey, congrats on that donation there, Doc. Good morning.
Yeah, good morning.
So let's just catch up. Haven't talked to you. It's been a minute. I know you're busy. Where are we, just real quick, status on moving the child maternal health ward out of GMH, the COVID hospital, to the COVID-free hospital at GRMC? Any progress on that, Doc?
Chris, you always ask me that same question.
How long have we been talking about that?
Yeah, I'm consistent, Doc.
It's been a few weeks, I think.
Yeah, let me tell you something, okay? What's reassuring is that the mother and the babies are still at GMH, okay? So that tells you something. The projections that they put out, it's all wrong, because the only projection that you need to look at is the mother and babies at GMH, okay? It hasn't moved. So what does that tell you? We're going to be okay, right? Because mother and children are still at GMH. That's one big indication that GMH is okay, because the bed count is low, okay? Low means that the COVID-19 hospitalization rate is low. So that's good. That's good for Guam. The ICU, the ER staff, the doctors there are doing an excellent job. So that's the reassuring thing for me and the island. So, the governor can project 3,000, 5,000, 6,000 deaths as the worst case scenario if they want. But, the projections that they're using are based on Wuhan or big city projections, okay, with high density. And I heard that they compared it to Singapore. that's like comparing apples and oranges, because Singapore has 6 million people in the same geographic location or the same size as Guam. I mean, talk about density there. If you ever watched that movie Crazy Rich Asians, where they have all the towering,
right,
2,000, 3,000 people in one single building, those are the density that we're talking about in Singapore. So you're comparing apples and oranges. Certainly, I think it's a good exercise if they want to do that. So call it an exercise for that matter. But when you put up projections like that, that's really not reality. Okay, so I know that the beds capacity on Guam right now, I think we're way below that we anticipated. The projections they had, by now we should have about over 100 COVID-19 patients at GMH, and we don't have that. So I think that the job is done with GMH. Doctors and nurses are doing an excellent job with Jolene again. I think they should be applauded for that. I think what they should do now is to plan on a way to get out and recover. So that's what they need to do. I would suggest keeping the gates closed still, because you don't want any new viruses coming in. But I do still agree with the lockdown, but I think the lockdown should have been done when I wrote the letter back in March 17. We've done a good lockdown March 17. What is it today? Today is March 16th, right?
April 16th, yeah.
April 16th. I'm stuck in March. Oh my goodness. Time is moving so slow. And I think the people of Guam is getting anxious. Okay? So we need to reassure them, how do we get out of this? But I think the administration right now is still prolonging this, but we need to look at the realities that we can't be locked down forever. So we need to start planning on how do we get out of this lockdown, rather than saying we got to keep going. Our projection is 6,000 deaths or whatever it is. That's good to do the exercise. But right now, I think the bed capacity is good. The Navy, the Army, or then the Air Force is jumping in, which is good. They get tents set up. That's great. But I think the key here is really not prolonging the process as into June or July or August, or waiting for the next vaccine to come out. I think the key here is to plan the recovery. And how do we do that? The key here is, to me, is to be watching the gates of the airport. Okay? We hear the Philippines is going to open up their airlines again. I know the governor has always said she can't, stop the airlines from flying. Quarantine is good. Maybe, start getting testing up there. I saw passengers get off the plane, test them right there at site. That may be the gateway to keeping the virus from coming to Guam. That's where it came from, at that airport. So I think that's where they need to set up their shop. That's my opinion.
Interesting opinion, Doc. So are you basically saying that Guam is going to be the first place in the world to beat COVID-19? Is that what you're kind of saying?
Well, if you look at the hospital curve, if you look at the hospitalization curve on Guam, it's been pretty flat. It's been pretty flat. It's going downwards. And I pray daily that it does that. That's the curve that I'm following. And I read the positives. Because, even the governor's office has said, assume everybody's positive. If we're going to assume everybody's positive, then why are we keep testing, right? So we know the clusters are there. And if people comply with stay at home, don't go out, if you don't have to. And I think that's ingrained in the people already. You're going to have stragglers, okay? And I agree with some people that's protesting that they don't want to stay home. But we can't speak for everybody. Not everybody's going to follow those orders. So I would agree with Senator Nelson and the governor to continue the lockdown, which they should have done it a long time ago. They wouldn't have been in this place at the very beginning. We would have been out of here. But I think we need to continue that for the next 2 weeks minimum, and then by the end of the month reassess. If the hospital curve continues to stay flat, then you can start loosening it up a little bit. But continue the mask, continue the social distancing. Rather than 6 feet, maybe go 8 feet. And we require that. Let's take a step further. If you want to be cautious, let's do that. But I think we need to start planning on how to get out of this, rather than, hey, let's prolong it. Our projection is saying this. But there's no model in the world that can project what Guam is like. Our island is flat. We're not a towering island like New York City or Singapore or Wuhan. Okay, so we need to take those things into consideration. I think they know that, but I don't know. Maybe they're doing it because of federal funding. You got to follow the money, where this is going, because perhaps this is what FEMA wants to do. If we don't give them the projections, they won't give us money. Maybe then tell us that. That's okay. But I think we need to look at reality and look at the curve at the hospital and look at the bed capacity. Because right now we're over. We have a lot of beds. So we need to make sure that we take care of our own patients that need to take care of, from the very, very beginning, chronic illnesses and stuff like that. We need to continue to do that.
But Doc,
The other
what?
thing-
Oh, go ahead.
Go ahead. The other thing that I want to talk about too is that memo that came out that want to confiscate everybody's mail for items. I disagree with that. That to me that's a federal crime if you're going to start digging into people's mail and confiscating things. I mean, it's not a contraband. If it's a contraband, you declare it as illegal. If you're going to declare a product as illegal, then declare that as illegal and go ahead and confiscate it. But if it's not illegal, don't take it away, because there's certain reasons why people are ordering stuff.
Well, I wanted to ask, because the Physicians Advisory Group, Dr. Felix Cabrera, just the other day was saying that, we're still not out of the woods. This is just the beginning. This can come in waves. And so...
when I first interviewed with you, I think when I was in Hawaii, or, one of the reporters there, I said that this thing was coming waves. Just like everything I said, they're repeating the same words. The invisible enemy, the war and virus, lockdown. Those are the things that I already documented way back in March. So these are not words that's new to me or to the people. The wave effect, like I said, the key is going to be at the airport, not really the community. Once you have a good lockdown, you isolate the virus, you contain it, the island is going to be okay, in my opinion, if you have a good lockdown, because you're going to starve the virus. But what's going to cause the wave is the new viruses coming in, okay? And that's at the gate of the airport.
All right.
Thanks, Dr. Shea. Just, hey, that was, I'm processing everything you just said, and thank you again for your time, and we'll reach out to you tomorrow, maybe next week, to catch up on I got to ask you the same question again next week.
You're so funny.
Hey, just looking out for the
right?
pregnant ladies.
That's the gauge.
Yeah.
If they're talking about, hey, we need more beds, we're in a dire situation. We're not out of the woods here. Well, then why are the mom and the babies are still at GMH? See, that's my biggest gauge.
I'm not sure if I detect a little sarcasm here, because you're masking it pretty well.
A little bit, but you started it, Chris.
You started it.
I started. Okay, Dr. Shea.
Thanks, Dr. Shea.
Wash your hands.
Bye-bye.
Okay, 6:51. Hey, I just got a
Dr. Sunshine. We've got Dr. Doom. We've got Dr.
we got
Sunshine.
Dr. Doom. You're funny.
You're funny.
Yeah, so we are getting Dr. Doomsday on at 7:45. Dr. Cabrera. No, man, and it's interesting that we have this wide spectrum of opinions from the doctors, but
and they're the ones we're supposed to be listening to, right? So it is interesting to see the different perspectives that they have on what's happening.
And of course, they're human; they're going to have their perspectives. But is the accurate right in the middle, or are one of them right? I don't know. But
for me, I'm just like, I'm going to stay home. I'm going to do what I need to do, wash my hands, and just listen to whatever what they're telling us to do.
Right. The problem I have, and what keeps me cautious, and what keeps me from just we got all these zero positive, let's go, is because I just don't have faith in the government response for COVID-19, because they're not being transparent. So I don't know what information we're getting out front and what information they're keeping in the back. So, knowing that and being out here every day talking to all these people, you can put two and two together. So and there's just a lot of politics in it. And that's why I think everyone should just continue to stay home. And if we go a week with no positives, then fine. But
just for clarification, that is what Dr. Shea was saying.
Yeah.
Still stay home.
Yeah. But we haven't done the mass testing. And, the governor yesterday during her press conference said that they are working on increasing the testing capacity. And she said by the end of the week,
something like that,
GMH would be able to test, I think, 100 samples. But, we get the results.
Not sure if it was just GMH or we were going to see an increase from both labs, because now GMH has the capability to do testing.
Right.
But the whole idea, I thought, was we were going to increase and start testing more people for COVID. And I don't even know. Are we still just testing the priority groups?
I don't know. We didn't we got Linda yesterday, and we didn't get
the clusters or the But definitely, I mean, it still looks like we're still testing the same amount. I mean, that's 19 plus 13.
Right. So if you're keeping track of this, Public Health routinely does 40 tests, and yesterday they did how many?
19.
And then GMH did
13.
So basically, to us, it seems like they're just splitting the load.
Yeah, well, we don't even know if Public Health is also still testing for the region because they are the regional lab.
Right. And so that to me, that's why I still am very, I think we still need to, we got to stay home. We got all these things because if you have several doctors saying the same thing, which is the peak is coming in.
Didn't Linda say GRMC they're also going to be able at some point to start testing? Because I think they have, they're getting a gene expert.
Yeah.
And public health has a gene expert.
Yeah.
We're still waiting for the 4,000 test kits.
That's right. So what's going to happen in the next couple weeks, Bree, is we're going to see a lot of people being tested on Guam.
Unless they still limit it, so.
Right, yeah. So, I mean, I don't know. I think the key here is, I mean, if you look in all the jurisdictions all over the world, even just up in the NMI, the key, I think, is mass testing.
Well, yeah, with their South Korean test kits.
Yeah, and so this has been interesting, the reaction to these South Korean test kits from, Dr. Cabrera, the Physicians Advisory Council, and the governor. You heard the governor.
Yeah, they're not FDA approved, so she's not going to risk it being used here.
I wonder how that makes the people in Saipan feel. I mean, they got like 60,000 of these test kits, and we got our governor saying, oh, you guys, that's the generic one. Ooh, we're not going to use that. I mean, that's what kind of reminded me of. I was talking to a friend of mine last night, like, right now, the governor in Guam, we're that stuck-up rich cousin that you have to the CNMI. We're looking at the CNMI like, oh, South Korean tests? Oh, my God, generic.
Hey, but we're going to get these ones that are FDA approved from Abbott Labs, and plus the equipment, that's 200.
Yeah.
That was what Dr. Cabrera read from that letter from Dr. Cruz, that he received a commitment of 200 rapid test kits weekly.
Right. So it's not like CNMI got, 60,000 test kits and we're just sitting here twiddling our thumbs. If you listen, we've had Linda on, all the government people, they've been saying that they've been trying to ramp up the number of people that we can test. We just haven't seen it yet.
Yeah.
They open
the numbers go up with the testing.
With the numbers of tests, like we don't even get the number of DLS tests that are sent out, I believe. So anyway, just keep watching and listening, and we're doing our best to get you guys the info. So David Della Sola, the labor director, we're going to get him on. We got to take a break, but he does have the WBA, and we're going to put that out this morning and find out what the next step is in terms of you guys, getting closer to getting this pandemic unemployment assistance.
And federal pandemic unemployment compensation.
The FPUC.
FPUC. FPUC and PUA.
That's what they're calling it, okay? This is a family-friendly show. It's 6:56. It's the KUAM News takeover of containing COVID. Good morning on you, Guam.
Dear people who haven't had
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD.
At the Guam Memorial Hospital. 8 unclaimed bodies were buried 2 weeks ago and another 2 on Tuesday. Father Gofigan, along with the Arimathea Society, said the clearing of the GMH morgue was a direct result of the coronavirus pandemic.
And yes, we are cleaning it up, and we are trying to make
Hi, everybody, this is Ryan Flowers from Crescent Fitness. this is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Discounts and so much more. KOAM deals exclusively on KOAM.com. Find your deals today and let us help you save.
Nobody likes that guy. You know, the guy who always brings a veggie platter to a party. Who wants to be that guy? Not you. You're the guy who brings something everyone loves, like the Variety Taco 12-pack from Taco Bell. It comes with 6 original crunchy tacos, plus your choice of 6 Doritos Locos tacos. Mix and match your favorite Doritos Locos taco flavors, nacho cheese, Cool Ranch, or fiery. So when the next party comes around, you know which guy you're gonna be. The Variety Taco 12-pack, only at Taco Bell. Live Moss.
Try McDonald's oven-baked apple pie. Wrapped in a warm sugar-glazed crust, it's perfect with premium roast McCafe coffee. And remember to practice social distancing. Use our convenient drive-thru to pick up the delicious food you love. We'll be there at McDonald's. I'm loving it.
Banners, posters, stickers, partial or full fleet vehicle wraps, metal signs, window and door wraps, road and construction signs, sublimation, promotional items, and so much more. Victoria Printing. For 30 years, we've been your one-stop printing for all your needs. Call us today. Located in Tamuning across the Lupang Beach Tower. Call us at 649-4581. Victoria Printing and Graphics. Let us help you with your company printing needs. Trusted on Guam for 30 years.
Adulting isn't so hard when you have a mobile plan that lets you live in the now. With Docomo Pacific's Gen Z Club, pay as low as $50 a month when you bring your own phone. Get endless local talk, text, plus endless access to your favorite apps like Spotify, YouTube, Instagram, Facebook, Twitter, and more. Everything you need to live your best life. Join the Gen Z Club today. Some conditions apply. Docomo Pacific, better together.
different chord progression. And I know that you're worried about someone else.
CJ Blas, get on up. 703. Containing COVID. Good morning on you. Thursday, the 16th day of April. 1 month and a day since the first announcements of 3 COVID-19 positive patients, and results last night, 0 tested positive. So we'll have more on that. And then from the Physicians Advisory Council, Dr. Felix Cabrera coming on at 7:45. But let's get the labor director, David Delasola, who's there's been a huge development in the PUA and the FPUC. So good morning, Dave.
Good morning, Chris. How are you doing today?
Very good. Can we just get right to it? Like, what is the new information that you have for us?
Well, we finally got the PUA dollar amount that came in yesterday afternoon. It's going to be $345. So that will be the 39-week payment benefit amount. And, of course, last Saturday we got the $600 confirmed also. So essentially between April and July, you will be getting $945 if you are unemployed or laid off during those periods a week.
And then it's the $345, right, for the January.
Will be before during the March or after the July. It'll go back down to the $345.
Okay.
So that's good news. So, and they also gave us guidance on how to write our supplemental budget request. So we are putting the final touches on that, and we'll be submitting that forward to USDOL for approval. And I think I mentioned to you that it's coming out at over $900 million.
Yeah.
Wow.
Yeah, that's a huge, running almost $1 billion program.
And that's still based on the
within a month or so.
Whoa! So we're hoping to get this online within a month, or is that when the payments you're expecting to come out?
I know that's what everybody's asking me. When am I going to get it out? When am I going to get it out? For me to put it, I'd like to do it within a month, but so many factors are what USDOL will do. I mean, they took this almost a couple of weeks just to give me the 345, and you would think that would be something easy. So I'm going to get that supplemental budget request, $900 million package together and sent out this week. Then we have to wait to see how long they're going to take to approve it and then load the funds to us. And those are two things that are not within my control. And so, I can't predict how I can move forward if I don't know when I'm going to have the money in my hand.
Right.
And that's something that really sucks, because I can't tell you. I know everybody's waiting out there. Everybody wants and needs the money, and I'm trying to run as quickly as I can. And this is, a kind of an ongoing story with USDOL. They're doing the best they can with the $2 trillion care package, and they're trying to roll it out with everybody. And Guam and the territories are just a certain niche that they're trying to take care of, but we're not the highest priority when it comes to other states and other people. But we're running as quickly as we can. And I got an email the other day which made me feel a little better, that, hey, Dave, that software package that you're looking to stand up for Guam, do you mind sharing that with Hawaii? Because I think they're looking at trying to find something too. So if you follow the states, you're finding out that there are several states that their systems are failing. They have these old COBOL Fortran systems, and they can't handle this program, this new PUA program. They're trying to meld it into their existing software, and it's not working, and they're having major problems. So at least us, I'm trying to stand up a new custom software package that marries with this employer package, which I'd like to talk to you about, and then our Hire Guam package. All three speak together and they're cloud-based. So I'm hoping that we're not going to run into any problems with the number of people applying and bogging down our system, since it's not all going onto one little pipe into a server. So, that's good news in this, if there's anything, that we're going to get a brand new system that's up to date and should be able to be tailored specifically for Guam, and even the other islands can use this system if they so, if they like, and they're looking at us too, because they're on our Hire Guam system, and we help them implement the Hire Saipan, Hire Palau, Hire American Samoa, and so this module, which drops right into the Hire Guam, will also drop into their modules if they so choose to take it up.
Is Office of Technology assisting you with this stuff, Dave?
Yes, Frank Lujan is very much aware and helping us with this software and the implementation of it. So the other part, if you don't mind, Chris, that we're getting ready to stand up is the employer module. I'm sure you heard about the executive order, which was passed last week, mandatory reporting of your layoffs, furloughs, and reductions of hours to me, the Director of Labor. And I've been trying to get that package installed so that it would be a web base, and they can just go in there flawlessly and enter their data, and then update it as whenever the situation occurs. So today or yesterday, there's the first phase is I'm calling out to all employers only, not employees, to go to Hire Guam and register your company. That's the first step. Register your company, and from there we're going to verify. If you have a business license, you can email that to us, and once we verify it, hopefully the software company has told me that they're going to flip the switch on the employer module within the max 2 weeks, a week and a half, give or take. And then once that switch is flipped, then they can start entering all their employee data and all their layoffs and everything. And that'll be used for confirmation for the employees that come in and claim. So those, I'm hoping that that USDOL will accept as a viable proof of their status when they apply and they don't have an employee verification that they were laid off, that I can we can just go on the system and look up their company and look their name up, and it'll be there, and when they were laid off. So that's one less thing that employees will have to worry about if they don't have a letter already.
Right, and so Linda from Public Health was telling us that they're kind of doing the same thing with those people who are applying for the SNAP benefits. Is there's a list that came from the employers where lists all the workers furloughed, hours cut and stuff. So it is good to see that our people who have been, telling us that in order to apply for these things that we keep getting told to apply for, we need all these documents, and it's good to see that you guys on the government end are doing what you can to help them out with that, because we're supposed to be staying home.
Yeah, and that's the whole thing. And I already know that there's at least 15 to 20% of the population that didn't get an employment document, and I've asked a myriad of questions to USDOL to see what is the minimum they will let me get away with, but still meet the auditing requirements. Because if we don't meet the auditing requirements, then Guam gets dinged, and Guam has to pay for it. So there's a fine line that I'm trying to get to, that's shelter in place, keep the people safe, keep our employees safe, but still get the applications and figure out a way to get them inputted and with all the proper documents that an auditor would see and would allow me to, release checks out. So, things are moving smoothly. I am still having to wait for USDOL to catch up with me, and all I can do is just keep planning ahead, laying all the puzzle together, and just waiting for their piece to slip in there, and then I can rapidly put in the rest of them.
Okay. So the WA, just to recap, the wage benefit amount is $345 for the PUA, the Pandemic Unemployment Assistance. $600 is for the federal pandemic unemployment compensation. So from April to July, it'll be $945 for those who qualify, and then it tapers down to $345 after that for a total of 39 weeks?
Yes.
Okay.
And the only other little caveat is that those who have reduced hours, and try not to get too complicated, and if I understand this correctly, now, if you're working at a reduced hour rate, and if you make more than $345, then you get nothing. If you make under $345, if you make $344, then you get $1 of the PUA, and then you get the $600 of the FPUC.
Okay.
If you make $345, you get nothing. So that's how I was given guidance on how the PUA and the FPUC will work. So you have to make under $345 in your reduced hours to qualify.
Okay, so that's good to know. We'll get that info out there. Is there another program or anything, Dave, for people who have had their hours cut but they're making more than $345?
Nope. Other than the stimulus money that everybody's going to be getting, there's the PPP program, which is the SBA program, which companies can avail to, where they get that a loan, but it can turn into a grant to help pay for your employees to stay at work. Mm-hmm. So there just keeps every other day there's a new program popping up that you have to try to keep up with. And there's lots of money that's coming in, and we just got to see which ones apply to Guam and which ones don't. But there are, the FLMA, the one with the paid 2 weeks paid leave that you can avail to, which is a tax break. So there's a myriad of things that employers can do for their employees. It's just a matter of picking which one is the best fit for them.
I had just one question for clarification. Because this is April through July, say this program doesn't kick in for Guam till May, is that retro?
Yes.
It is, okay.
Yeah, so you'll be getting so if you were laid off or something in March 15th, then you would get the $345 up until the period that the FPUC kicks in, and then you would get the extra $600 kicking in, and that would all be retroed until you get caught up to the present time.
Dave, I just had a comment here. Are you saying $345 a pay period or $345 a week?
A week.
A week. Okay, so there you go.
$945 a week, which equates to roughly $23-ish an hour, or close to $50,000 a year. So that will help this island and a lot of the people recoup and kind of get back and hold them over. Remember, but that money is only going to go up till July, end of July.
Mm-hmm.
So, and that's what it's there for, is to help people get caught up.
Like a bridge,
because we all know that there's some people that have been almost a month already.
Dave, sorry to interrupt. Are you saying, just because we're getting the comments in real time, $345 a week before or after deductions?
This is $345. I don't know if they're going to take out.
No, Dave. I'm talking about how you said the reduced hours, people who make less than $345.
Oh, that's a good question. Yeah. I would think it's gross, but let me get back to you. I don't want to speak too prematurely.
Okay.
So,
But just for
that's
the
a good
people
question,
commenting-
and I'll text you back.
Thank you. Yeah.
When I get that answer for you, just to make sure that I have it.
Right on. Well, Dave, appreciate it, man, and keep us posted. I got your number. I love that you call us and let us know when we got new developments, because obviously everybody, we're waiting on the federal government. I see a lot of comments where people are saying, "Oh, they're paying it out in the states already." Well,
No, they're not paying this one out in the states. The stimulus
is coming.
They are,
Yeah.
because they already have that mechanism in place, and they've already transferred that money to those states. Again, you can't compare them with us. We haven't even gotten the money yet
Yeah,
for any
I
of
know.
these programs, and they're not. We're not the same priority, and we're not getting everything the same as the states. And I'm not trying to justify anything, but we can't give out something that we. That's why the governor is giving out under 10,000, and we're using our local funds. We're doing that because we haven't gotten the federal funds yet.
right, yeah.
So we're trying to bridge and help that we can, whatever we can, with our local funds, knowing that they are coming.
Right. So again, people. How about people who are self-employed? We cover this. Yes, if you're self-employed, they still shoot it over to Rapid Response, Dave, just to kind of get it documented with you.
Those who are employers can stop using the Rapid Response and start to use the Higher Guam. But remember, all you need to do now is just register your company so that we can verify your company is an actual company. And then when the module comes in, then you just input all the employees that have been affected. And that will all be a web-based fill in the blank. And I've had people look at it, and they said it's pretty straightforward and simple. So please, employers, this is the time where you help your employees by coming in. Just yesterday, we've had over 1,000 companies register, and that was before the press release actually went out. So they are responding very well.
Do you have updated numbers on affected workers, Dave?
I haven't gotten it for yesterday. I will text that to you.
Okay.
I will get those probably within the next couple hours. I know that we were, I don't want to guess, but yes, they're still coming in very rapidly.
You're still looking at that 30,000, the 36,000 though?
38,000.
38,000.
Yeah, that was, like I said, a statistical model that Gary Hiles, my chief economist, put together and put together a whole summary write-up, and that'll attach to our supplemental budget request.
The 900 million.
Yeah, they needed proof, and that's why we had Gary do it, because they're not going to argue with the chief economist.
Mm-hmm. Gosh, that 900 million, that's like almost the budget. That was the budget projected for next
I'm
fiscal
used
year.
to the Chataans and the Pong Sung Hwa, which are like $10 million. And this just blows it out the water.
All of them wrapped into one and times
why,
4.
Okay, hold on. I think the last numbers I got, which was 2 days ago, was we're over 10,000 workers displaced and 9,700 workers reduced hours.
Wow.
So, and like I said, that's just the email forms. So we're still seeing a rapid increase of the emails. We're getting over 500, sometimes 650 emails a day, and I have a crew of people that are using that to tabulate it and to distribute the questions to the right departments, and we're trying to keep up with that load. And we're, like I said, forming this whole PUA program, organizing it, and ordering and trying to get the quotes for the procurements and getting things stood up as quickly as possible so that we can run with this as soon as the money starts releasing.
Right on, Dave. Appreciate that. And I think, again, that's just what people need to hear. We know, it's federal. It was a new program. We didn't have the UI here. So just standing all this up, I understand it's, logistical. It's quite a big thing. So appreciate you keeping us posted. We got to run. Thank you so much, Dave.
Thanks,
Thank
Dave.
You, Chris. Appreciate it, Sabrina.
Okay,
of course. Of course. Yeah. Wash your hands. Never gets old.
All right, Dave Delasola, he just got the final number, the wage benefit amount for the Pandemic Unemployment Assistance Program. It's $345, while the federal Pandemic Unemployment Compensation is $600. So from April through July, it'll be a paycheck of $945, and that is every week, right? Every week. And then it tapers off after July to $345.
You can't quit your job and go on the PUA, okay? Because people are telling me like, wow, that's good. Ooh.
Yeah.
So
he's going to submit a $900 million supplemental budget request to the feds.
Yeah, that's. I imagine waking up and seeing $900 million in your bank account. Wow. 724. Let's keep it on the phones, and someone we've kind of chatted with a lot since this all started. He's a numbers geek. I think that's how you describe yourself, right, Doc?
I suppose so. Numbers guy, sure.
Yeah, numbers guy. Okay. Dr. Peter Lombard. Just real quick, so I know you're crunching the numbers. What do you make of these last few days of test results, Doc? I'm curious your take on it.
Well, I think everybody agrees. Definitely a positive sign, and it almost makes following the numbers. It's going to be boring here if all we see are zeros and ones every day, which is good. But even watching the charts isn't going to matter anymore. What matters more than anything is following any signal that there's a new cluster and outbreak happening. So you get 1, then 2, then 3, and then we're going to start to panic again and start watching a little bit more closely.
So I wanted to ask, what did you make of Dr. Shea's comments, Dr. Lombard, earlier on the show? If you guys didn't check out, you can go back and watch it later. But Dr. Shea basically saying that we can be hopeful, maybe.
Yeah, I think everybody's thinking that and feeling that. I don't think he's alone there. I'm certainly feeling pretty hopeful that the impending surge is definitely not coming. So I caught a little bit of what he was talking about, and I think everything that he said was pretty much on point there. We know that we're not out of the woods, and we don't want people to let their guard down. And want to stay on this course. Now we just there's so many unknowns, and that's the problem. There's so many unknowns, and everybody's going to be the expert now on how we get the economy restarted and what restrictions we're going to extend, how much, what signals we're going to look at.
Kind of losing you there, Doc.
What's that?
Kind of losing you there.
Oh, yeah. So I'm just saying everybody's going to have their own opinions now about which restrictions we can relax for how long, and what signals we're going to look at to say, hey, we need to tighten the restrictions again.
Yeah, I mean, is it early? The governor yesterday had said that they're saying the peak is coming later than we anticipated, and although she did kind of speak briefly on when she would start to talk about relaxing restrictions, I think for the most part they're like, it's just way too early.
Yeah, well, you got the sense that they're talking about it, and that's a good sign. And I don't know how candid she's able to be about how close they are to seriously be considering something like that. And all this talk about peaks is still, very much dependent on these models, which I think that we're finding that there are a lot of flaws to them. They show this big peak that's 2 months in the future. And the other problem I had initially with that model is that even in the countries that were way ahead of us, you weren't really seeing those countries follow the models that we were using at the time. And it's still the best thing that we had. But I think you've got to do a combination of modeling and also looking at what's happening elsewhere, and then using your own data and your own local specific details. We're an island. Dr. Shea alluded to that. We're an island. We can close our borders a lot better. Maybe we're doing a better job of containment and social isolation than other countries. And then there's all these just strange things that happen. Like why is New York hit so hard when they've got a lot of population density, but a lot of countries in Asia have just as much population density, but they're not having the same thing. Are they underreporting? Is it a factor? There's more obesity in New York. There's less mask wearing. There's so many unknowns, and that's been the hard part all along. So to move forward in a way that we can have any assurance that we're making the right decisions is going to be difficult.
What about mass testing, Doc? I mean, I haven't really put a lot of faith, just personally, in the test results because I don't think we're testing enough people. So it's kind of like, just for me, it's just too little of a snapshot. But I know you crunch the numbers. What can you tell us about mass testing, and are we ever going to get there? Because the governor clearly doesn't want anything to do with these South Korea tests. But we're getting some tests, but we're not getting 60,000.
Yeah. Well, we have to be pretty careful now about when we mention testing, which tests we're talking about, because as you I'm sure know, there's the serologic test, which test the antibodies, and then there's the swabs, which tell you if you have active virus shedding. So consider for the moment, let's say we successfully starved the virus as a thought experiment. We're not going to get any new active tests anymore. So if all we do, we can test hundreds of people, and they're just all going to be negatives at this point. Now, those active throat swab tests, like the Abbott actually is a very fast throat swab antigen test, they're going to be extremely valuable if we have new clusters show up. And because we weren't able to test a whole lot of people very quickly before, now if they identify one positive, they're going to be able to go out and do their tracings and just test a ton of people very quickly. So that, from that perspective, we should be able to respond to new clusters very quickly because of the expanded capability we have to do those antigen tests that should tell you if you have an active positive person. Now, the South Korean test, the antigen, the serology testing, it's fraught with complications and caveats, I should say. And you can get into that a little bit more through my blog post, but I think there's usefulness to it, even if the tests aren't as reliable as we would like for them to be.
Right. They said they're using it for surveillance.
Yeah. What does that mean, Doc? They're using it for surveillance.
It means you're gonna test a large portion of the population, not necessarily whether they have symptoms or if they even ask for it. You're gonna ask them, hey, can we test you? Whether or not, and if they agree to it, you test them, and then you can get an idea of if they come positive, meaning they've been exposed and they mounted an antibody response to the virus. Then you have an idea within that population of people what the percentage of people have been exposed to it at least. The ones that are positive, you immediately have to ask yourself, are they active? So that's why they're talking about you still have to back it up with the other type of test, the one, the throat swab to see if they're active. But the problem is, even if they're positive on the antibody test, it could be a false positive for a number of different reasons. There may be some cross-reactivity with other viruses, other types of coronaviruses that they've had in the past, so they've got some antibodies, and they're close enough that it matches this test. So they might have positive antibodies, but they're not actually, they maybe never were actually exposed to the COVID virus, which means you tell them that they're in the clear, here's your immunity passport, and they go back to work, and then they get exposed, and they expose other people when they thought that they had already cleared the virus.
Right.
So there's a lot of caveats to it, but I still think that despite those caveats, I still think there is a place for surveillance testing and a place where we can use those type of tests. Now, the FDA approval thing just kind of throws a monkey wrench into everything. I don't understand quite what authority the states have to use non-FDA approved devices. There's definitely times as providers that we can decide if we think it's clinically indicated to do something what we call off-label or not use a medicine or a treatment in an off-label way, as long as the patients consent to that and they understand the risks and benefits that we're trying to get. So I don't understand how what difference there might be in Saipan that allows them to use these devices, or if any state can make that decision on their own. So there's still some unanswered questions there for me about that.
But I felt like the response here, and I don't know how much of it is political. I think some of it is they just ran over the idea of using these South Korean tests, and for all intents and purposes, it just looked like a really, really hard no.
Yeah, that's what they tend to do. They make a decision, and then they sort of they don't really give a thoughtful response. It's just like they'll give the reason why, and then just kind of stand behind that without any really good discussion about, well, is there any way that we could use these in a rational way? It's just, no, we decided this for safety reasons, and that's the end of it.
Let me read you this thing, Doc, that I just got. Sorry, Bree. Go ahead.
Oh, no, I just wanted to ask that the test kits, the rapid test kits that we are getting from Abbott Labs, are those serological, or are those, do you know if they're
They are
PCR?
not serologic tests.
Okay.
That's a good question. I
Okay.
think that because the word rapid's in there, a lot of people are thinking these are the serologic tests.
Mhm.
These are not serologic tests. You do a throat swab, and then so you have the same complications or the same potential problem with not getting a good swab. Okay, you don't get a good swab, and it's still not going to be positive. But they sort of amplify virus particles, so you can detect if there's a virus on the swab.
Right, Doc. I wanted
Are
to
the
read.
ones in South Korea, the
No.
ones in the CNMI, are those, do you know, serological?
I don't know for sure, but my guess is that they're serologic.
Okay, so I wanted to read this from FDA.gov, Doc. It's a policy for diagnostic tests for COVID-19 during the public health emergency. I'm just going to go right over to, there's a page. I can send you this if you want. Page 9, last paragraph here. The FDA requests that the state or territory notify us if they choose to use flexibility to expedite COVID-19 testing. The FDA will not be reviewing the process adopted by the state or the territory, which we understand may be different than the process adopted by New York State. The FDA expects that such states, as part of their oversight process, will require laboratories developing COVID-19 tests to validate those tests prior to use. The FDA encourages laboratories that develop testing to send an email. So basically, it kind of seems like they're giving the states and the territories the flexibility they need, right?
That's certainly what it sounds like there. I've been to the FDA site too, and I get really confused.
Yeah,
I'll
I know.
Go down these.
Well, that's not good because you're a doctor.
Yeah.
Oh yeah, I'll go down.
Don't
these
say that
rabbit
out
holes.
loud, Doc.
It's confusing. I mean, they have this emergency use authorization, and there's different EUAs. Like there's an EUA for what's called point of care testing. You can use it in the clinic or the hospital, and then there's EUA for laboratory testing, like it has to be done at DLS or at the public health lab. So some testing devices have EUAs already, and a lot of them don't. And I think there's a list published of the ones that have the EUA, and then there's probably a whole bunch more that have written that letter to the FDA, and they're sort of in the process of getting their EUA. And maybe some of the serology tests that we've ordered, maybe some of them will all of a sudden be on that EUA list. We'll be able to start utilizing those. I think that what we're doing in Guam, and I don't know, but I'm guessing that they want a little bit more reassurance instead of just saying we'll take any test that comes in. Let's at least make sure it's on the FDA list for EUA before we start using it. If you don't do that, it just makes things a little more complicated to write policy and how we're going to use the test. And that's, that's a separate issue, I suppose. If you're thoughtful about it and you put together a good policy that allows for us to do that in a way that
Man, I'm just getting so much on the messages end, Doc, about this. People are sending me that, these South Korean tests, they have preliminary FDA approval. It's really interesting in looking at how the governor and Dr. Cabrera talked about this, looking at what they said and what they didn't say. Now, what they didn't say was that, like you did, the states are getting, hundreds and thousands of these tests. What they did say is they weren't FDA approved, but what they didn't say was that there was a preliminary FDA approval. So,
Well, I don't know if they either didn't have the time to get into more details, or they didn't want to, because to them it's just a closed issue. They're just going to
I think that's
make a
it.
decision and let's just move on to the next thing. And I don't know if states are using the non-FDA approved device. Actually, I haven't seen. I actually don't know the answer to that. Are any cities or states using the non-FDA?
I'm just looking at national media stuff, and WhatsApp is about to die from people sending me all these links about.
But like you said, moving forward, so we're going to be getting these 200 rapid test kits that from Abbott Labs, and they are.
I think they're being used already. I think in Guam.
Oh, already?
Remember? I think yesterday they reported some GMH test results. GMHA.
Okay.
Right, and those.
But it was like 13 tests.
Yeah, I think that's the Abbott. Yeah, so I don't like you said earlier. I don't understand the numbers, but still.
Okay, no, that letter that they read, it was by Dr. Cruz, was that we have received a commitment to receive 200 rapid test kits, but I guess maybe they're already here. Sometimes I get confused with Linda, because Linda talks so fast, and so she says we have these Avid, or are they Abbott machines?
Abbott, ABBOTT.
So they are Abbott machines,
right?
Not Avid.
I think
Abbott.
The takeaway is, though, that we're not getting the 60,000 test kits. They're probably just not going to do it, because I noticed that if they say no, it's like no. There's no changing it. No matter if the speaker writes 10 more letters saying, "Oh, what about this or this?" There's
Yeah,
not
but
gonna do
Dr.
it.
Cruz said that also in that letter that if they are FDA approved,
yeah.
then
Boom.
Yep.
So
stop.
They're still working that issue for sure, and
Mhm.
even though they're not saying everything that they could, but I know for sure that they're working on that issue as well.
right.
So,
But we actually have Dr. Cabrera call it. He's going to be calling in right after you, so we're going to ask
great.
him all these questions. Yeah.
He's way more important than I am. So.
Oh, come on. But,
There's no quarantine on opinions. What my friend said over here.
Right. Yeah.
Hey, Felix and I, we see eye to eye on a lot of things. That we had a nice chat the other day, and I think we are on the same page with a whole lot of what's going on here in Guam.
Right, and I think despite what people out here are saying about the zero positives, what I kind of base my feeling on is that the government of Guam is continuing to move forward, doing things like, making more morgue space, doing things like standing up these fields. So the response from the government is continuing to go towards these projections and the bad case scenarios. So.
Right. That's, you wonder if at some point, common sense will prevail and they'll say, let's stop devoting resources to that. If it's no longer plausible, and they keep mentioning this word plausible, worst case scenario, well, when are they going to adjust to say, okay, this is no longer plausible, let's not devote resources to it? And even the federal government, they're going to spend a ton of money putting up these field hospitals. At some point, will they say, yeah, let's scrap the idea? I don't know. Maybe we'll feel more comfortable if those hospitals are up, just in case. But again, if it's not plausible, should we devote our resources to that? And we're not the ones going to be making that decision.
Right on. So just listen up and you'll see what Dr. Cabrera has to say, Doc.
Okay. All right. Take care.
Thank you.
Take care.
I feel like I'm at the hospital. There's just so many doctors. You got Dr. Shea, Dr. Cabrera, Dr. Lombard.
I don't like going to the hospital, but I like being informed like this. So.
Right, yeah. So, Dr. Cabrera, we're going to take a quick break. I'm going to get him on the phone. Again, good morning to all of our Facebook Live listeners. There's just so many ways to catch the show. Thank you for watching the stream. Please share it as real information, real time. We're also obviously on I-94 FM. Thank you to Andy Wheeler, the Morning Brew, and the I-94 family for allowing us to come in here and do hopefully a temporary takeover, okay? And also streaming on the KUAM news app, KUAM.com. There's an audio stream on Docomo Channel 10. And then in 20 minutes, we are going to jump over to KUAM TV 11, and you guys get to see our cute outfits on TV. Especially for the Monomco who are waking up, they drink their coffee. So it's a 7:41. It's containing COVID, the KUAM News takeover of Guam's favorite.
Half a day, Guam. Stay.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Holiday, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in.
The Governor's Physicians Advisory Council. Doc, I don't know if your ears were burning because everybody's been talking about you this morning.
Oh, well, I hope it's in a good tone.
Yeah, it is. So I guess just first of all, can we get more on this the Korean tests? And, you know, everyone's talking about the CNMI and they're getting 60,000 tests. And then you guys came out. You read a letter from Dr. Mike Cruz yesterday kind of throwing water on that South Korean test. But, you know, can you just re-impress upon us? Because I see that the FDA approval, that's like the big reason why you guys don't want to engage with these tests. So maybe if you could, again, I'll just give you the floor and maybe reiterate that for some people who are saying that, you know, other places are using these tests, and do we really want to hang everything on that FDA approval?
Yeah, and so I think it's important to understand that we continually look at all different options, and that, so, you know, in this crisis here, you know, every option's on the table. So we're evaluating and reevaluating all our different options. And in this case here, in particular, it's you know, I don't know what you know, I'm trying to understand completely the mentality around, you know, the CNMI getting these test kits, and if there's envy that's behind it as well. Because in the end, there's, you know, I'm happy that they've made a very you know, clear choice about what route they wanted to do. And they pursued that, and that's good, and that serves their you know, their main interest, and their governor made that decision to do that. You know, in the end here, what we have different access to different resources. You know, the TR being here on island does change our access to resources, in fact, in a lot of ways, in a favorable way. And so we're in a completely different situation. And so, you know, everyone has to understand that and respect that. You know, I'm of course in a particular, you know, an awkward position here, being you know, born and raised on Saipan. You know, Saipan is still considered home. I feel I always call myself a son of the Mariana Islands, and in this position here, with what's been going on is I've spoken to Dr. John Tudela, who's the chief medical officer for the hospital there, and who's a big part of this, and so, you know, he and I are on the same page that, you know, that it's an understanding that this is that these tests are not FDA approved, and that their plan is to use it for surveillance, so not necessarily for clinical treatment and diagnosis, and so understanding what the purpose of the tests are as well is a key part, and it's not easy. It's not a straightforward answer, in that it's complex, and how you utilize it is complex, and so that's the key thing we have to understand. Now, the other part here, I want to, you know, there's all this talk about this being, it's pending FDA approval, it's all this, you know, so forth. I need to make it very, very clear that the FDA has, all these tests that we're using, technically the FDA has not approved a single one. What they give out is an EUA, or emergency use authorization. So it's an authorization to go ahead and use it. It still needs to go through its proper channels, you know, over time, in terms of reporting data, and in an effort to gain official FDA approval. And so with the test even that we're using here on Guam, like the Abbott ID Now, that's under an emergency use authorization, an EUA. To say it's FDA approved completely is not fully representing what the status of that test actually is. But the closest thing we got to, and it's the highest level that the country is using to the bar that the country is using to use tests. Now, does this mean the South Korean tests are not good? And absolutely not. It doesn't mean that. But what we can say is that we can't assure it yet. And if they want to take this route and be ahead of the ball in terms of anticipation that it may become, it may gain an emergency use authorization, then, you know, then good for them, and that's a great thing to understand. and a great asset for them.
Doc, I'm looking at something from the Korea Times. According to the South Korean Health Ministry, 47 countries have so far asked about importing these South Korean-made COVID-19 test kits, while an additional 39 countries have requested them as humanitarian aid. So I just want to make sure we're not like the last people to the party, and that and not entertaining this idea of the South Korean tests. I know that the governor had said that we're increasing our testing capacity, but are we increasing it to the point where we can just do what Saipan's doing?
Yeah, and so I wanna also be clear about the state of where Saipan is that they received the test kits, but it's not the instrument itself. And so it's like getting a bunch of DVDs but not having a DVD player. And so so they may have gotten these kits, but they're not ready to run for until they get the instrument, they get all the ingredients that they need.
Right, they said in 2 weeks.
Validated.
2 weeks, I think, was what we heard from the NMI.
Yeah, and so a lot can happen in 2 weeks. And in Guam's capabilities of expanding its our FDA EUA emergency use authorization tests are it could be very, very different in 2 weeks, and in fact we're on track for that. Now we talk about these Abbott ID Nows. They're kind of like the most ideal tests because they're so quick. They're low complexity, low to moderate complexity, and it doesn't take too much to validate it and to train the medical technologists to use them in the lab. So that's one of the things that's really important, that we increase the access to test kits for that, because that's going to be the most have the highest utilization. It's probably going to be utilized the most overall. Having 200 tests per week is key, and that's big. Now keep in mind that if you have 20,000 tests, that's great. But if your bottleneck is that you can only run 100 per day, that's going to take you 200 days to run those 20,000 tests. As an example. So we have to keep these things in mind here, and that there's multiple steps here and there's multiple pieces into actually utilizing these tests, and so we have to keep that reality in mind.
I'm just wondering, you said, or CNMI in 2 weeks are going to do this testing, and whatever the multiple is going to be, and we're still running 40 tests a day. I mean, is that the most amount that we can do? And
no, not
and like
anymore.
the AG said, we're a month into this, and we're still seeing 40 tests.
Yeah, and I think, Doc, that we've been hearing that we're going to increase our capacity. We're going to increase our capacity, but we just haven't seen the
increase
the
in
number.
capacity.
Yeah, so
and so what now that we have these tests that are so these instruments, the Abbott ID Nows have been validated. They're in use. They've run their correlation studies with the main tests that have been using the ABI 7500 at Public Health. And so again, the priorities are still with the sicker patients, with the patients that are suspicious for COVID, and recently, as we can see, that in a lot of cases they've ended up not having COVID, and so they're sick and admitted to the hospital for other reasons. And so it's actually really, really important that we know that, so that we can focus more in on their differential diagnoses that of why they're admitted to the hospital, and focus treatment on that. So there's a key part here in that testing. So we're still utilizing these available tests for hospital patients. And in fact, there's the question of, okay, we have the two Abbott IDs. One is at Public Health Lab, the other's at GMH. There's been conversations internally amongst the physicians advisory group, the governor, and including Linda DeNorsi. And yesterday afternoon, it came to a point of making a decision of where if the Abbott ID Now that's over at Public Health, would it be better served in a laboratory that runs 24/7? And there's only two laboratories on the island that run 24/7, and that's Guam Memorial Hospital's laboratory and Guam Regional Medical City's laboratory. And so those are still the process of and workflow of that is still being worked out, but it makes a lot of sense, and it makes a lot of sense to a lot of the providers, and ultimately we think that that's what's the best for the patients, both COVID and non-COVID patients, to have that rapid turnaround. So we're focusing more on that right now.
Right.
I think that what's going to happen is that, I know what's going to happen is that once we have these other testing modalities, like the Gene Expert, like the BD Max, these are other PCR machines that we're waiting for the kits to be able to really expand the testing. Then we can really change our recommendations to the island and to the island's providers on who to test and how, and then we can start really increasing these our mass testing. And using that, the PCR part is very, very important, because that's another form of confirmatory test. The Abbott ID now is technically not a PCR test, but it is a cousin of it that is still considered a confirmatory test.
Okay. So we're thinking about moving one of these Abbott machines from Public Health over to GRMC?
Correct.
Okay. And so what about Linda said that they have a Gene Expert machine, and they were expecting another one, and that was supposed to go to GRMC.
Well, no, GRMC already has its own Gene Expert.
Okay.
What we've been waiting on are the test kits themselves.
Okay.
And so Public Health has their order, GRMC has their order, and so it's a waiting game. It is one of the popular ones throughout the country, and so I think in all likelihood Public Health is going to get their order of test kits first.
That's the 4,000.
Yes, the 4,000, or I'm not sure how much of that's going to be is going to come at a time, but also to note that Public Health's Gene Expert has more testing, has the capacity to test more volume than GRMC does.
So GRMC is going to have a Gene Expert and a Abbott.
Mm-hmm. Yes.
Equipment.
And what we actually wanted to do was try and consolidate the Gene Experts, and it may make sense for GRMC to put the Gene Expert at Public Health. Okay. And that's more of a technical efficiency issue that makes more sense. And if it does, and if it's best for the people and increase the volume, then we're going to do that. And there's really nothing else that matters. If it really makes the most sense for the patients, and we can do it in an efficient way and an accurate way.
Point of personal privilege, Doc. I just wanted to ask here. It's been 3 weeks since you gave your projections. Are we going to get an update on those projections now after 3 weeks? And also, we have 2 minutes, Doc. So if you could tell us where we're at on laying out the hospital expansion plan for the capacity.
Okay, so 2 main points on that. And so the first point is that, we've been, in terms of the projections that we've been doing internally, we've been using that for our working benchmarks. What we're actually in the process of doing is actually consolidating that with FEMA's official projections. So thankfully, they started including the territories into their projections. And the good thing is that we're actually not far off in terms of what our projections are. And so we're consolidating those the points there, so that and we had a call with them just yesterday morning, and we were going over some of the points that can help refine their projections, and then we will actually switch over to using theirs as the official one, and what we'll use for planning purposes. So once we get that, and we think we're going to get the next rendition of that by Saturday morning, and so we won't be presenting anything major until after that time. Now, in terms of the build-up, now we have to understand. I heard the parts of Dr. Lumbert's interview, but talking about resources and when should we consult, this is not the time to be talking about pulling back on resources. When we can see, we've been trying to test, just testing by itself. It's been a month, and we were trying to get testing, increased capacity, 1 to 2 weeks before we even had our first positive. So we have to understand that if we let up, our foot off the gas in trying to get our resources here, we're going to be, we're going to be caught off guard here if we try and pull back at all, at any time right now. So, but with that being said, there is a plan for a phased-in potential build-out. So it's not like we're going to add 2,000 beds and boom, let it sit there and wait. No, it's what do we do to first add 50 beds? What do we do to add another 50? And then maybe 100 here. And so it's a phased-out plan that's being refined every single day. And the more we get information about the resources that actually are available, and instead of just ordering it doesn't mean anything in terms of planning. It's about what is the likelihood we're going to get it, and when are we going to get it.
Thank you, Doc. I appreciate it. We're going to get you on after 8. We're switching over to KUAM TV 11, but are you going to be at the press conference today?
I probably won't be at that press conference today.
Okay, so we'll just I'll touch base with you later, and keep us abreast of when we're going to see the next plan and the next projections.
Okay.
Okay. Thanks, Doc.
Thanks, Chris.
Okay.
Thanks, Sabrina.
Wash your hands. Dr. Felix Cabrera, we're going to take a break, and we're going to bring all of this over to KUAM TV 11. It's containing COVID. The KUAM News takeover of Guam's favorite I-94, KUAM FM, Hagatna, Guam. Good morning on you.
this unprecedented crisis every Wednesday on KUAM News Instagram social media platform. These weekly posts will feature profiles from Guamanians making a difference on our island home. Frontline Heroes is presented to you by Docomo Pacific. We don't have to be together to work together. Stay safe and stay healthy. Docomo Pacific, better together.
So
Abiba islasen para honra, para gloria. Abiba islasen para todo y tempo y paz para ita dan gini langit na bendición contra y peligro na fan sa fuham Deus protegis languam contra y peligro na fan sa fuham Deus protegis languam. I wanna ride in my Guam bomb, stroll all around, rolling up from the Lido and back to zero down. They come from zero down, zero down, zero down, zero down. I wanna ride in my Guam bomb, stroll all around, rolling up from the Lido and back to zero down. They come from zero down, zero down, zero down, zero down.
Wow, that took me back, man.
Soldier rise, coming back to this without.
Last minute, zero down. Containing COVID, it's the KUAM News takeover of Guam's favorite 807. Good morning to our viewers on KUAM TV 11. Remember, we are bringing this show to you every and any way we can. Live on the radio, of course, KUAM FM, Agotni Guam, I-94, 93.9 on your FM dial. We're also streaming live at KUAM.com.
Such a pleasure to work with you and see you every morning.
What's up, sunshine? And also, we are streaming live on the KUAM News app and KUAM.com. There's an audio stream on Docomo Channel 10. And, of course, right here on KUAM TV 11. You know, shout out to all of our team here at KUAM. We're a multimedia company, and we just all got together, and let's get this out everywhere. Okay, so it's 8:08, and as we do at the 6 and 8 o'clock hour, we take a deep dive into the day's COVID-19 news from the KUAM News team. Sabrina Salas Matanani. Good morning, Sabrina.
Hafaday, good morning, everyone. According to the latest from the Joint Information Center, their latest release coming out at 9:45 last night. The Department of Public Health and Social Services tested 19 individuals for COVID on Wednesday. 0 tested positive through public health and 19 tested negative. GMH, which now has testing capability, tested 13 individuals on Wednesday. 0 tested positive through GMHA. To date, there are a total of 135 confirmed cases of COVID-19 on Guam, with 5 deaths and 73 recoveries. Recovery meaning a patient is no longer considered infectious. According to CDC research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All 57 remaining cases are in isolation. The governor's chief medical advisor says the South Korean rapid test kits being used in the CNMI are not FDA approved. Dr. Michael Cruz is not recommending use locally to increase testing capabilities. His comments were in response to a letter written by Speaker Tina Muñoz Barnes on Tuesday, raising the possibility of using those same test kits on Guam. During yesterday's media briefing at Adelup, Dr. Felix Cabrera read the response letter by Dr. Cruz.
So, dated April 15, 2020, Honorable Tina Muñoz Barnes, Speaker, Iminajunta Singput, Dalil Session, Abakan, Guam Congress Building, Saganya, Guam. Dear Madam Speaker, Governor Lou Leonguero's Physician Advisory Group is in receipt of your letter dated April 14 regarding the potential use of South Korean test kits for COVID-19 confirmation. While it is clear that mass testing is essential to combating this virus, that testing must be safe, accurate, and reliable. Unfortunately,
as recently as yesterday afternoon, my conversations with the U.S. Food and Drug Administration indicate that specific test kits alluded to in your letter have not yet received FDA approval or an emergency use authorization. This is despite the fact that some international media have said the exact opposite. To be clear, this does not mean that your suggestion is without value. The kits referred to in your letter can be used to determine COVID-19 infections on a presumptive basis. This simply means that results, both positive and negative, will have to be confirmed by another testing meeting FDA and CDC standards. Given the national shortage of test kits, some U.S. jurisdictions may be willing to adopt protocols that deviate from the standard of care. But that is not the direction dictated by our present circumstances. Pending additional guidance from the FDA and CDC, we must understand that through more testing should be done, unreliable test results can become even more dangerous than no testing at all. Because even one COVID-19 positive patient can be an unwitting weapon against our entire community, I fully appreciate your desire to rapidly develop our testing capacity. This is why we work to obtain rapid ID test kits and equipment from Abbott Laboratories. Guam has received a commitment of 200 Abbott ID Now test kits a week, which can obtain results within minutes. Additionally, these kits have received emergency use authorization by the FDA. As a physician and former Lieutenant Governor of Guam, I understand the immense challenge faced by island leaders today. Please note that I and other physicians actively review testing and treatment innovations of COVID-19 throughout the world. If tests like the one that you have mentioned can return a credible result, one that is accepted by the FDA and CDC, I will have no problem recommending their use. Our advisory group also understands that both science and technology behind COVID-19 testing is rapidly developing. For this reason, we are preparing to outline protocols for the adoption of new tests. Until then, should you have any information demonstrating that this foreign test has been approved by the FDA and CDC, please feel free to share with me.
Again, although the South Korean test kits aren't an option for Guam, Dr. Cruz announced that we have received a commitment of at least 200 weekly rapid ID test kits along with equipment from Abbott Laboratories that are emergency use authorized by the FDA. Meanwhile, Governor Lulian Guerrero also during that same media briefing stressed why we are not using the tests from South Korea.
In healthcare, it's a very sensitive, I think, service to deliver to our people because it can mean life or death. So there are standards placed, there are best practices placed, there are guidelines placed, there are validations placed. There's a lot of scrutiny and there's a lot of protection and there's a lot of regulation. So to assure the public that whatever procedures, whatever equipment, whatever treatment we provide for our very, very essential and crucial community, that they are based on standards and they are approved by entities who monitor and regulate those procedures and treatment and equipment. So these tests that are coming in have to go through that same scrutiny. And so as governor responsible for the safety of our island and the health of our island, I am very much determined that we have to abide by the rules, the regulations, the standards. These test kits are not FDA approved. They're not even EUA approved. And so I don't want to risk to our community the possibility of these tests being not effective, being not accurate, being not reliable. Because what that means is if this test gives you a negative and you're really a positive, and the test says you're negative and you rely on this test, that gives you a sense of false security. That gives you a sense of false positive and false negative. So a false negative person may think, oh, I don't have COVID-19, but they really do. And as a result of that, they may think, oh, I don't have to wash my hands anymore. I don't have to isolate myself anymore. That's the risk and the consequences of allowing approved kits to be used.
From the Department of Labor, Director Dave Della Sola was on our program earlier today where he announced that he did receive the WBA, that is the wage benefit amount for the unemployment assistance programs. It's $345 for the pandemic unemployment assistance program and $600 for the federal pandemic unemployment compensation. That is a total of $945 weekly for those who qualify for the program, that is April through July. From there, it tapers down to $345, which is the PUA. Also, from Department of Labor, they are requiring all employers and business owners who have displaced workers due to COVID-19 to register and email their business or contractor's license to vosemployer@dol.guam.gov for verification purposes on the department's virtual one-stop system. Or you can just go to hireguam.com and find the information there. Senators, they are expected to go back into emergency session at 3 o'clock this afternoon, where they are expected to vote on Bill 335. That legislation is relative to the emergency powers of the governor during a public health emergency. You can read the bill in its entirety at guamlegislature.com. However, what you won't find there is an amendment that was added to it by Vice Speaker Talina Nelson. It states that prior to exercising her authority relative to curfew and shelter in place, the governor shall make available to the public, 1, any and all plans for obtaining and distributing test kits for COVID-19 on Guam and future plans for conducting tests on island. Any and all information regarding the number of PPEs available to the government and plans to obtain and distribute PPEs in response to the COVID-19 public health emergency. Also, to the extent practicable, information regarding known public places at which any confirmed positive COVID-19 individual has frequented 7 days prior to testing positive. And the final amendment is access to COVID-19 testing for individuals who have come in close contact with another confirmed positive COVID-19 individual. And that is a new section that is included in Bill 335 related to curfew, which will be going up for a vote at 3 o'clock this afternoon. An update on the USS Theodore Roosevelt. As of today, 94% of crew members have been tested for COVID-19, with 615 positive and 3,958 negative. 4,046 sailors have moved ashore. 5 sailors assigned to USS Theodore Roosevelt are in U.S. Naval Hospital, Guam, being treated for COVID-19 symptoms. One of those sailors is in the intensive care unit for increased observation due to shortness of breath. In national news, the government is making preparations for the time when people are allowed to ease back into society. Natalie Brand has more details from the White House.
It's going to be very, very close, maybe even before the date of May 1st.
The federal government is working on strategies to reopen the country. The Washington Post obtained a draft proposal of CDC and FEMA guidance for state and local governments. The agencies are recommending that first, there's confidence infection rates are, quote, genuinely low, and the health system has the capacity to handle a new surge of cases, and that there's a well-functioning system to test and trace patients.
They're diagnosed, and then they're isolated, and then their contacts are traced. That's going to be fundamental. This outbreak got beyond containment this time. We need to get it back, so the containment's an important part of our overall strategy.
CDC Director Dr. Robert Redfield says some elements of social distancing will remain in place until there are medical developments such as a vaccine.
It's state governors who will ultimately decide when to reopen their communities, and the president is expected to speak to the governors this week about their plans.
I will then be authorizing each individual governor of each individual state to implement a reopening
Tuesday, the president also said he's suspending funding to the World Health Organization while reviewing its response to the pandemic.
It's $830 million plus over the last 2 years, and all we needed was the truth in return.
The United Nations issued a statement saying now is not the time to reduce the resources of any organization fighting the virus. Natalie Brand, CBS News, the White House.
Organization funding dangerous and illegal, and says it will be swiftly challenged. Chris?
All right. Thank you so much. That's a deep dive into the day's COVID-19 news. We're getting Nestor Lecanto has been covering a session and this curfew bill, the fine bill, and Senator's scheduled to go into voting today, so we're going to get with Ness and get his perspective, and then also the governor with a stern call out of the senators yesterday to kick off her press conference. We got that too. It's 8:21. We'll take a break now. It's Containing COVID, the KUAM News takeover of Guam's favorite I-94. Good morning on you, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD.
Way at BK Hagåtña, Tumon Bay, Micronesia Mall, and the airport.
Hey, KFC on the mic again. Promise we'll be gone after this. Yeah. So let me tell you about this girl, yeah, she's so fine. And every single day she's running through my mind. And I just wanna call her mine. Because your smile makes my
Hey, good morning, Guam.
Hey, hey.
Just let it rock a little bit. Nothing wrong with some KFC for breakfast. Sounds good, right? 8:25. Good morning with Sabrina Salas Mantanani. It's the KUAM News Takeover, Guam's favorite, containing COVID. Our KUAM TV 11 listeners, thank you guys so much. Everybody watching on Facebook Live, keep those comments coming. We're paying attention. I'm doing about 62 million things over here, so I can't always jump on and comment back. But
you're getting a workout.
We do see those comments, and Ken Sanity. You can throw him a follow on Instagram. He's a big part of what we do digitally. And so thank you so much. That's at Ken Sanity. Little known fact. I got to shout him out because, in another lifetime, pre-COVID, when you talk about esports, the name of Ken San Nicolas, it echoes through the annals of the... Is it the annals? You know what I mean.
Halls.
Yeah, the halls.
You're good.
Okay, he's good. He's up there, all right. 8:26. So, Ken, you want to do for some of these comments here? Sure. Yeah, right. And also, shout out, of course, to Joe Sir, DJ Joe Sir, also in another life. We had lives before this.
We did, didn't we?
Good morning. Good morning.
Hey, Ken.
So we have a bunch of comments today, most of them regarding the new test kits in Saipan and why we aren't using them here. We have a couple here from Maria Prado. Do you mean that the test kits from Saipan, are they not FDA approved? Justine Ray Rodriguez Flores adds, no, but if it makes them feel better, neither is Guam, only EUA from the FDA. And some people asking about the process of being a positive patient and then being classified as negative.
Right.
Like, do you have to retake a test, or do you just sit through the 14-day quarantine period with no symptoms, and are you automatically allowed to go back?
I mean, this is a tough one, Ken. Even with the recoveries, I'm not even confident that I almost feel like we're just churning out people and saying they're recovered. And I mean, if you look at the national news and how they cover recoveries and what it takes to be called recovered, and I think Dr. Cabrera spoke a little bit about it during the press conference yesterday. So keep those comments coming. I know a lot also were about the PUA and the FPUC. And, we had the labor director, Dave Della Sola, on. Again, share the show for real information, real time. Hey, a session scheduled for today. I know they're going to be voting, and we got Nestor Lecanto, who is, of course, doing a great job keeping a focus on the Guam legislature. Before we get him on, I wanted to play a clip yesterday. The governor started her press conference by calling out the members of the Guam legislature.
Much of the debate centered around the powers I should have in this emergency. At various points throughout this emergency, senators have asked me publicly and privately to execute curfew and clearly enforce the mandates of my executive order. These same senators argued that these extended powers were necessary to save us from uncertain times. Now, some of the same senators say these ideas are excessive and overreach and wrong. While this is the equivalent of being tossed the lifeline only to watch bystanders toss away the rope, I respect their decisions. I only hope we won't be back here in a few weeks asking for the power to fight a surge of new cases. Regardless of what the legislature does or does not do, no matter how they help or withhold help, my job is to keep Guam safe with every tool at my disposal. Nothing will deter me from that mission.
Well, there you go. Some stern words from the governor of Guam for senators. Ness, what did you make of those comments that the governor kicked off the press conference with yesterday?
Well, first of all, the governor was giving us a little bit of a civics lesson. She used to be in the legislature herself, and so one of the things that they do is they stick their finger in the air and see which way the public sentiment wind is blowing. And so that's why we've been seeing a little bit of back and forth here, a little bit of waffling on the part of the legislature on this particular issue, because the public is kind of divided on it. Should we not have a curfew? Is this an infringement on our civil rights? or has it been how we have been successful so far? And it was heartening to know that we had 0 positive cases. So the question is, whether it's by design, coincidence, divine intervention, if this is working. And so that's actually saying, why mess with it right now?
Right.
Do what we're doing. So that's really what they're faced with. And that vote is going to take place about 3 o'clock this afternoon, along with 6 other bills. But most people will be keeping an eye on Senator Amanda Shelton's bill that would allow the governor to implement a curfew, although they did amend it to include certain caveats, if you will, like it shall not extend beyond 15 calendar days, and that it should be the least restrictive means necessary. And we asked the governor about that, but she wasn't real clear on what that would mean to her. What exactly does that mean when the legislature says the curfew, if implemented, should be the least restrictive means?
That reminds me of the thing they did with the budget, and it was like, cockfighting shall be the lowest priority of enforcement ever anywhere.
Yeah. And so they kind of left it up to her interpretation of what less restrictive means, and she didn't really, at least from my point of view, didn't really explain it in great detail. She didn't say, okay, from this time to this time, and this is what we're going to do. And so it remains to be seen what that means.
I'm wondering if she's aware of the new section that was added with the Vice Speaker's amendments that it looks like it's calling for more transparency.
Yeah, you got that amendment?
Oh, I got. Do you have a copy of the amendment?
Let me put that in the chat.
No, in front of me.
Yeah.
So
I'm going
the
to put it in
amendment,
the chat because the Vice Speaker's office sent it to me this morning.
Because we've been hearing a lot about it.
Right. So go ahead, Bree.
All right. So prior to exercising her authority relative to curfew and shelter in place, the governor shall make available to the public 1, any and all plans for obtaining and distributing test kits for COVID-19 and future plans for conducting tests on Guam. 2, any and all information regarding the number of PPE available to Gov Guam and plans to obtain and distribute PPE in response to the COVID public health emergency. 3, to the extent practicable, information regarding known public places at which any confirmed positive COVID-19 individual has frequented 7 days prior to testing positive, and 4, to the extent practicable, access to COVID-19 testing for individuals who have come into close contact with another confirmed positive COVID-19 individual. That's pretty.
That sounds like a veto to me.
Yeah, that would normally be subject to germaneness, I think, because it kind of has a little or nothing to do with the governor's ability to impose a curfew. So, yeah, that'll be interesting to see whether or not those particular amendments by the Vice Speaker kind of determine what the governor is going to do.
Mm-hmm. Even
I know. Well, we know she wants the, and I think that's what part of the argument between the Vice Speaker and the minority leader, Tala Taitagu, that I think you guys played that clip. I think a lot of people were listening to that clip too.
Going around, yeah.
Yeah, that's one of the things. Those particular amendments, whether or not that would be cause for the governor to. Not sign the bill.
She's going to totally not sign it. The governor is looking at that and saying, "I'm not going to tell you guys anything." She's not even telling anybody anything now. So I don't. And we've heard this from senators who have been calling into the show that the lines of communication, at least for the minority and certain Democrats, those lines don't even exist. What other bills, though, Ness, are going to be voted on today?
Okay, I think there's 6 other bills. There's a bill by Senator Therese Terlahi regarding expedited procurement of medical supplies. There's a bill by the Vice Speaker regarding the school year for seniors. Mm-hmm. I think it's regarding, an exemption from the service learning graduation requirement. There's a total of 7 bills that would be up for voting. But like I mentioned, I think Senator Shelton's bill regarding curfew is the one that's generated the most public
Right.
discussion and interest.
I'm wondering if we're going to see Bill 334 reappear.
I thought at one point that it would, and Bill 334 is the Speaker's bill that would provide the governor with the teeth, right? if you will.
This is the $5,000 ticket bill.
Well, I think it
Yeah,
was
I think
amended.
Yeah, I know they
down
amended it,
to,
yeah.
an up to 1,000, so to reduce it. But that has been referred back to committee. I don't think that's going to be resurrected, at least not in this particular session.
Right.
All right. Okay.
Yeah. So I mean, that's what else are you working on, Ness? I know you got a lot on your plate.
Well, I think one of the things that has been surfacing in different WhatsApp chats and social media is if the government is also working now on a plan, and they might feel it's premature, but is there, because there's a lot of national discussion, President Trump wants to start reopening the economy by the end of this month or the beginning of May. And like the governor of California has already issued like a 6-point plan for how he would reopen the country's largest economy, state economy. So is that exercise being done here? Has there been discussions? Have they brought in the Guam Chamber of Commerce, GHRA, other small businesses to plan out how we would resurrect the economy once this COVID crisis starts to wind down to a point where you can start reopening non-essential businesses? So I don't know. We haven't posed that question yet. So
Yeah.
I don't know if the administration has even started looking at that issue.
I know it came up I think it was yesterday in the press conference where they didn't fully discuss it, but it was mentioned that, hey, when we get to this point where we decide which restrictions are we going to pull back on, but then she brought up, was it Singapore was the example?
Yeah, Singapore.
And Hokkaido in Japan, where they had dialed back some of the restrictions and then saw these spikes. And so now the conversation they were having yesterday was kind of mentioning that COVID comes in waves. And if you relax the restrictions, you could potentially see, these days, like they're having, I think it was like 300 some new positives in a single day.
Yeah, and that's the same debate that's going on nationally too. Is the president's push to get the economy opened as quickly as possible, risking another even worse wave of
kind of crazy. I think it's kind of crazy watching that. Like, what are you guys talking about? People, like 2,000 some people died of COVID-19 in the U.S. yesterday.
Yeah, but I do know that there are a lot of businesses now that have been receiving the federal the PPP loans, and they've actually gotten the money deposited into their accounts. So they've actually got that in hand, which is a good thing. And clearly we're going to rely primarily on federal money to keep us afloat. I don't think there's any question about that.
Right. And so that was one of the questions that was posed in the press conference yesterday, Ness, was when we get this 100, there's so many different accounts, the congressman's saying one number, the governor's saying another. I don't know what the actual number is, but one of the media did ask the governor, what are we going to use this money for? And she said a lot of it is going to be to replace, money that we've spent for the hotel quarantine, for just a bunch of different things. And then I think she also said that they're applying to be able to use the money to recoup lost revenues, which they, according to what she said, can't do right now, right?
Yeah, I think a lot of times, most of the times actually, the federal money, there are restrictions to it, to how it can be used, right? For those particular grants that I think it's 117.6 million or something like that. That's the money that she's been referring to. Then there's also the money that for unemployment and the direct grants. Those goes to the people, and there's no restrictions on how that's going to be used. And then there's the money for the businesses, those loans that can be turned into grants after a certain period of time. Those are restricted too. I think they have to use 75% of that money, those loans, to keep employees on board, and then they can later prove that, and then they don't have to repay the loan. So there's so many different sources of money. I mean, friends of mine joking around that the Uncle Sam has opened the vaults, and he's cranked up the money printing press.
Well, they could print it, yeah.
There's a lot of money. There's a lot of money that's becoming available.
You know what I thought was interesting, Ness, and I don't know if I'm just nitpicking, but when they asked the governor, what are you going to use this money for? I didn't hear anything like, we're going to use it to bridge, bridge finance people with some, cash in their hand now to make, because we're getting Daphne on the phone at 9:15 to find out about the stimulus checks, but I don't know, just thought that was interesting. But I want to read this from the congressman's Facebook. Yep, Michael F. Beast Nicholas, our congressman, writes...
I caught that.
Oh, you did? The largest federal direct payment, $141.5 million to the government of Guam in history, is en route through the CARES Act we passed in Congress. We have urged the governor to manage local cash and prioritize paying tax refunds and allow these federal funds to pay for ongoing COVID-19 operations, which are 100% of unbudgeted government operations at this time. We've also received a request from the governor to assist GovGuam in gaining access to a credit facility reserved for large jurisdictions, and we have heard her concern about using some of these direct $141.5 million payments for government shortfalls. We'll work to help you, Governor. Your congressional office is committed to bringing the maximum amount of relief and support to the people of Guam, that we may emerge from these times a stronger island and people.
Okay.
Yeah, I don't know how much I want to, take stock in a Facebook post, but, it almost seems like a credit war, because if you look back at the beginning of this, the congressman had put up something like, I'm not going to come to Guam because I don't want to expose you guys to COVID, and then I think the next day we had our first 3 positive cases, so I think he's just kind of been over there, and I'm not sure if he's directly involved in this, and I know he's not, but apparently everyone's trying to take credit for it.
Yeah, well, it is an election year.
Oh, what? It is an election.
I almost forgot.
Forget that sometimes.
God, what? Okay. Well, hey, Ness, thank you. Anything else you want to add in closing here?
No, we will continue to monitor and lots of breaking stuff, and so, yeah, it's a crazy time that we live in.
I tell you.
Stay safe.
That is an understatement. Wash your hands, Ness.
I will.
Okay.
All right, take care, guys.
Okay, guys. 8:45 or 8:41. Hey, we're also going to go over to the Department of Corrections and talk with Major Anton Uggan about what's happening there at the island's prison. Of course, the Attorney General. That was kind of the big reason he said that he released these 2 perps that were involved in that Harmon Breeze incident. So
not just them, though.
Right. Okay.
They're issuing these notices to appear if they're non-violent
offenders.
Right.
Hey, and that was just, so with this interview we did with the AG yesterday, I put it up. It's on our KUAM News YouTube. We had Adriana had heard from the victims yesterday. Obviously, they're very, very upset, and what the Attorney General come out and said was that nonviolent offenses like property crimes, drug offenses, all these types of crimes, these people are just going to be, put back out there with a notice to appear, 50 million years from now or something. That's a
right.
A little bit of an exaggeration.
But if it's like rape, obviously murder,
right?
It's a BNC, a book and confine.
There you go. So it's 8:42. Hey, we're going to do Chamorro News for our Manamco viewers on KUAM TV 11, and we are coming back with more of Containing COVID here on KUAM FM I-94 Hagatni, Guam. Good morning on you.
Buenas noches, the KUM headline.
Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Hoffaday, I'm Jonah Goncharfris, Senior Producer for KUAM News, and I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home. To protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home. Make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Hi, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
The soldiers and airmen
of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
This is a compilation of words written down on the board of my dreams. This is a complicated line with too much rhyme and sound, it seems. But you seem to love when I sing. The troubles do sing to love when I sing. The troubles do sing. And why I gotta be so afraid when you know this feeling will never fade? So God
hold me
and never let me go.
Yeah. Hey, shout out to all of our local artists who have stepped up big time, man.
Oh, yes. Tomorrow, another episode of Stay Home Living Room Edition of Live Local Fridays.
And another one. Who we got tomorrow, Brig?
I don't know who we got. We got Andrew Kumatauta.
Yes, we do.
Chris Boomer.
Uh-huh.
Daryl Garcia.
Baba B.
Joe Guam.
It'll be a good one. And we're going to keep doing it. Okay. 8:51. Guam's favorite. Let's get Tomas Manglotny, our CNMI correspondent, on the line here. Tomas, first of all, I got to apologize for all the Guam hate on these South Korean tests.
Envy?
Yeah, I think it's test envy. I'm not sure.
Well, good morning to you too.
I guess you just do your thing, and then, as always, we'll do our little Q&A after. So, again, with the very latest and what's happening with COVID-19 in the CNMI, Tomas Manglotny. Good morning, Tomas.
Good morning. So the governor announcing again that there's the renewal of the declaration of state of public health emergency and continued declaration state of significant emergency. They also noted in that announcement that it was on January 29th, 2020, when the Executive Order 2020-01 was issued, declaring a state of significant emergency regarding the COVID-19 outbreak. Governor Torres and his Lieutenant Governor Arnold Palacios also proposing late last night draft legislation that would effectively suspend evictions and foreclosures in the Commonwealth during the COVID-19 public health emergency. This is the first we're hearing of this news with regards to evictions and foreclosures, as many CNMI residents are also raising those concerns. We know that the legislative leadership will continue to, they're saying that they hope that the legislative leadership and the administration will continue to utilize the whole of government approach to protect residents. We also got a chance to chat with Congressman Ed Probst yesterday. He tells KUAM that there is a House session later this afternoon at 2:45 p.m. I believe he'll personally be live streaming that, but we also are working to get the agenda to share with folks about, I know they're going to be talking about the furloughs that the furlough letters that have already been released, especially to some of the CNMI educators. Governor Torres also announcing that the CNMI government employees are eligible for the PUA, the PUA, Pandemic Unemployment Assistance, and the Federal Pandemic Unemployment Compensation. They're clarifying that the United States Department of Labor on Wednesday officially notified the CNMI Department of Labor of the eligibility. They say that for both PUA and FPUC, ensuring the protection of an estimated 6,000 government employees from executive departments and autonomous agencies. They also know that the CNMI Department of Labor will be the primary agency in announcing the program and will specify the date, time, location, telephone numbers, and email addresses for the submission of the PUA and or the FPUC application. And so, Bree and Chris, as we've been telling our viewers, we're also going to be interviewing U.S. Congressman for the NMI, Kilili Sablan, at 10:15 this morning, and got a chance to email him early this morning. He's looking forward to sharing complete information, especially with regards to the CARES Act and any other legislation in the works at the national level for the CNMI.
Wait a minute, Tommaso. Let me get this straight. You are going to interview the delegate who represents the CNMI in a live format, and you're going to be able to ask him questions and follow-up questions That sounds pretty amazing.
Yes, and he made, I think in the email, he also said this is his first interview with KUAM, so he's looking forward to reaching out to constituents on Saipan, Rhoda, and Tinian.
Yeah, that's really cool because obviously we're out there in the NMI with the stations of KUAM, and the way I look at it is we're just one big family. So it's good to have you there and reporting on stuff that's happening in the NMI, and I think you're doing a great job. And there's definitely a need for people here on Guam to know about what's happening in the NMI, and also the other way, the NMI, that need to know what's happening here on Guam.
It's also the first time for us to interview a congressman, I think. In
this term.
Yeah.
I just got to say, Tomas, that, we all know that Congressman, our delegate, Michael St. Nicholas, has a very, very close relationship with the Republican Party of Guam. And, I had reached out to one of the high-up Republican Party guys, Juan Carlos Benitez, who, has kind of been one of the guys that Congressman St. Nicholas shouts out that, he depends a lot on Juan Carlos. And, I made the ask. I said, hey, Juan, whatever the congressman's issue with KUAM is, just reach out to him. I know you have his ear. Reach out to him and tell him, hey, let's just start over here. It's COVID-19, life and death. It's a pandemic. People want to hear what you're working on there on the federal side. And the congressman's response, according to what Juan Carlos told me, was don't get in the middle. And so that's where we're at with our congressman. And it just really is just, I don't know how you find time for that kind of mentality. But in a way, I guess we turn the page. The ask is always there. It's always available. But that's why I kind of want to commend Congressman Khalili Sablan, because he's definitely on the transparency side, and he does look like he has his stuff together, is one way to put it.
Yeah, we're going to have at least 30 minutes with him. We're going to talk about that meeting he had with FEMA's response to the letter that the three regions heads, Puerto Rico, U.S. Virgin Islands, American Samoa, Guam, and the Northern Mariana Islands. In that meeting, he shared that letter with us, and also asking to talk about the CARES Act. We know that there's continuing to be news about that practically every day with regard to its application here. So I know folks are tuning in. Got to also say a lot of the viewers are sending in good questions to ask as well. So got to thank folks watching from home who are curious, because this is of course about them.
Right.
All right. And I think we're going to try and make some room to actually broadcast that on KUAM tonight. So stay tuned, everybody.
Yeah, there you go. And Tomas, again, I thank you so much. You're doing some bang up work there in the NMI.
Yeah, thanks. It's all just to get informed. I think that's our goal here. We don't have any hidden agendas. We're just trying to get the info out. So.
That's it, Pansit. Thank you, Tomas.
Thanks, Tomas. Be safe.
Wash your hands. Oh, there you go, Tomas Manglotny. I was talking with him last night. He's a friend of my daughter's, and I realized that we've been doing this containing COVID, and he's been calling in for like a month. Yeah. And the most I've ever said to him is, "Hey, okay, you're there. Okay, hold on.
Wash your hands."
Yeah, let me put you on hold. So
he's a good kid.
Can we get the latest numbers, Bree, if you don't mind, from the Joint Information Center on COVID?
Sure. All right, the latest numbers from the Joint Information Center, and that was released at 9:45 last night. Public Health tested 19 individuals for COVID-19 on Wednesday. 0 tested positive through Public Health, and again, 19 tested negative. The Guam Memorial Hospital, which now has testing capabilities, tested 13 individuals for COVID-19 on Wednesday, and again, 0 tested positive. I'm trying to find my paper here. Here we go. There are a total of 135 confirmed cases of COVID-19, 5 deaths, 73 recoveries. And I know people were commenting about this on our Facebook stream. Recovery means a patient is no longer considered infectious. According to CDC research, and again, this is all from the Joint Information Center and published guidelines, a patient is classified as recovered after at least 72 hours have passed without fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All 57 remaining cases are in isolation.
Okay, 8:58. We're going to make time real quick to get Major Anton Uggan of the Department of Corrections on the line here. Good morning, Major.
Good morning.
So I guess just first, the last we heard from the Department of Corrections, as far as I know, was that the CDC had made the site visit. I know you had spoke with Adriana. Can you just fill us in? Just give us an update on what's happening with the prison and COVID-19.
Again, we had some. We had a group of officers that were put on quarantine, as per the director, on April 6th. On April 9, Public Health came into our facility and did a contact investigation. As a result, they determined that at that time that 6 of our senior officers and 5 of the recruits had close contact with the recruit that tested positive. So all of them are they're going on a total of 13 altogether. 13 altogether are expected to be tested by Public Health.
That was April. When was that? When was the close contact established?
The inspection team came in on April 9th.
So over a week ago, right?
Right.
And we're still waiting for them to be tested?
Well, no, my understanding, again, I don't know all this, but my understanding that there were a group tested yesterday and the day before.
Okay. Were you aware if any of them were exhibiting any symptoms between when CDC came out there?
No.
Okay.
Not that I'm aware of. Not at this time.
Okay.
Out of the 13 that were tested, 7 of them, we got word that 7 of them are expected to return to work on April 18th.
What about the remaining 6?
They're still waiting for some test results, I believe. Because the tests were given, I believe, yesterday and the day before. So they're still waiting on a few results.
So they still got to run them. Is that
right.
what they still got to run them?
Yes. Yeah. Whatever their process is when they're, I'm not sure of their Public Health process on the testing.
Okay, yeah, because if they were ran yesterday, they would have come out that night.
Right.
Yeah.
All right. So I guess we can assume, since they haven't been cleared to return to duty, that they haven't run the tests, or I don't think we can assume they were positive yet, right?
Because yesterday's results were 0.
0 positives. Yeah.
Mm-hmm.
Yeah. So yeah, we're still waiting for more results.
Right.
Okay. You said 7. I'm sorry. You said 7 were cleared. Were those the senior officers? Or
there were. No, that was a mixture of recruits and the senior officers.
What was the nature of the close contact, Major?
Sir, because I don't really know all the specifics on what their investigation was. I mean, they came in, they did their questioning, and I wasn't really part of that. I didn't get too close to them as they were doing their job, so I don't know what they were looking for or how close you had to be. I'm not sure.
But none of the close contacts were inmates or pretrial detainees.
No, not that I'm aware of. No.
And we wanted to get you on the phone because yesterday we had Attorney General Levin Camacho call on and basically say that nonviolent offenders are going to be booked and released, and the big reason was that he had brought up the prison and how scary it would be for us to have a COVID-19 outbreak in DOC. So that being said, Major, it kind of looks like the Attorney General at least is very, very concerned about what's happening at the prison. So what's your take on that? And should we be as concerned as the AG that it's the potential is so bad that we need to just book and release people?
Well, I mean, there's always a huge potential of the prison. That's always been a concern from day one. We've even had other attorneys and even the federal public defender before asking us to release people or making the argument to release detainees in light of the COVID-19. Now, in regards to the AGs, again, DOC, we don't play any role in the Attorney General's decision to release or not release. However, with that being said, our director has been working with the Attorney General's office again, and just asking if they could just take a look at who is being confined, and if in their best judgment they feel they don't need to be here, then release them. Mm-hmm. Overall, our population since the COVID-19 has decreased decreased, even including the booking reports. The daily booking has gone down since this COVID-19 thing started.
Okay. What about the detainees that are already in there and they are awaiting trial?
Yes.
How has the numbers decreased? Like, how many have been released? These are the pretrial detainees.
Okay, so I mean, I have to do more research on the exact numbers because we released we released quite a few different, not just detainees, but we have also inmates that we released.
Wait, you're releasing inmates as a result of COVID?
No. We have inmates that maybe complete their sentence.
Okay.
Or parole violators that were their sentence was done. So we released more than just detainees.
Okay. Okay. So I'm not talking about the inmates. I'm talking about the pretrial detainees then.
Well, okay. I would have to look more on my numbers because I have to run a report on that one to get all the numbers. But
do you have a rough estimate?
Is it 150, a couple hundred?
It'll probably be about a couple hundred, yes, that have been getting released. But you have to give me from what date to what date, a start date, because I would have to check my numbers.
I guess since the start of COVID-19, which was, March 17?
12?
Yeah.
To current.
Right. I would need to look at my numbers and run the report and double check and weed out those that were released as part of their full-time release.
Right.
I would need to look at that, and then I can get back to you with those numbers.
Major, let me...
Yeah, the reason why we're asking is because, Lieutenant Governor last week said that you were working with the judiciary and the Department of Corrections, the AG's office, to determine who can be released for non-violent crimes to alleviate, the overcrowding.
Is Major, riddle me this, is the release of these people, is it so that we can have a less crowded prison and then maybe entertain some semblance of social distancing?
Yeah, that's part of it. Is we don't want to stuff 8 to 9 people in a single cell. We need to keep the jail cells, at least on my side, for the more violent offenses that we need to keep separated. The Agani detention facilities population over the last few weeks has went down dramatically compared to what it was before.
Right.
Our overall population in the prison as of yesterday was 619. That's overall. This same time in January, in January we were about 684, 690. About the same date in January. So our numbers have gone down.
Right. But have they gone down enough so that if we get people who commit crimes like, terrorizing, you throwing hollow blocks into people's houses, do we have enough room to maybe use more judgment and lock some of these guys up until they get a court date? Or
I mean, yes, sir. We have room in the prison again, but the intent is to try to minimize. And again, we're not part of we don't take part in the AG's decision on who gets released and who does not get released. That's not us. We don't make those calls.
Right.
It's just in their judgment, that was the best thing to do. And, we do appreciate the AG's working with us and trying to ensure that only the most violent are locked up, or those that really need to be locked up are locked up.
Mm-hmm.
But again, at the end of the day, we're here to take whoever we need to take that needs to be confined.
You said overall population 619, right, currently?
Yes, that was as of yesterday.
As of yesterday. How much of that are actual inmates versus pretrial detainees?
So our local inmate population right now is about 340. The local detainee population is 214.
Okay.
But then we also have federal detainees, we have immigration, we have contempt of court, parole violators, overnighters, and warrant of arrest.
Okay.
And that would make up the entire population. But as far as local detainees, that's 214 right now, local detainees.
And what about federal?
The federal side, we have 36.
Okay.
So, Major, I just want to ask: are you guys still getting people confined? Like, what was Monday to Thursday? Did you get anybody that was booked and confined there?
Yes. I mean, last night I believe there was four or five last night. On the 14th of April, there was nobody. Nobody came in on the 14th. I think there may have been nobody on the 15th. I have to double check my numbers there. But for this morning, we had four. I believe four came in.
Okay. Let's.
But overall, the booking numbers have decreased. So on the average, before we were getting 11 to 15 a day. Now we're down to about 3, maybe 4 a day.
And when you say booking, that means they're arrested, they're
Yes.
booked and confined. And can you just clarify for me? When they're arrested by GPD, they go to DOC for book and confinement.
Right.
And then is that when the NTA is issued by the AG after reviewing the police reports?
So there's two ways they can get an NTA. The first way is when GPD arrests them. GPD on certain offenses has the ability to issue an NTA at the police station. And those are for probably petty misdemeanors, lower level crime. GPD will process them and book and release them at their level. But on the other side, GPD also will book and confine. Now, once they're confined, we give the overnight listing to the Attorney General's office, and they would review it along with the police reports, and then they would send us a disposition later that afternoon, probably around 12 o'clock or after 1, and say, okay, these following people will be magistrated. These following people issue a notice to appear, which is an NTA.
Yeah.
And then we just comply with those instructions and do what we're instructed to do.
Are you aware of that Harmon Freeze case? The one that we were reporting on?
I did not see no reports on that. I did see something on Facebook and the media about
Well, neither did the AG. Did you
I
see
was
that
just
interview?
wondering if they were booked and confined.
They were confined. They
Okay.
were in our-
And then the NTA came in and they were released. All right.
Yes, and then later that day, the notice to appear instructions came out and they were released.
That's nice. Were they happy about that?
Well, I know, sir. That's in a Ganya lockup, so I didn't get personally. Personally to see them and talk to them about it.
I wonder if they're freaking out. Like, what? Are you serious? we get to go? Yeah. Send a thank you note to AG leaving Camacho. You stop. Major, can we just switch gears? Because I got to ask you about the inmates, the detainees. We're getting a lot of, comments and calls, and I get a lot of side messages about the inmates and the type of, protections that they have inside the prison. And I know that you guys have stopped all the drop-offs, and so how are we ensuring the safety of the inmates, Major? And I guess we'll just go into this, but let me just ask the first question. What do you do when an inmate or a detainee is exhibiting flu-like symptoms?
So, Chris, we have, like I said in the past, we have GMH medical staff in-house. So we have our own internal medical team. If an inmate is displaying any kind of symptoms, they would immediately be referred to the medical staff. Then the medical staff will do their evaluation. We also have a doctor, 8 to 5, 5 days a week here, and on call if we need them. If they're distributing any symptoms, they'll go to the medical staff. The doctor will make the determination what needs to be done after that, depending on their symptoms. And if they need to go to GMH, then that's what we would do. We would transport them to where they need to go.
How many?
And we'll take our guidance from the medical staff.
Mm-hmm. So you have a clinic. That's where you had a clinic there.
Yeah.
How many beds are in that clinic?
Say again?
How many beds are in the clinic, or do you have beds there?
The clinic in Manila can hold about 3, but we've also been working. We've identified another area of the prison that, in the event we need to isolate those that are showing symptoms, have not tested positive, but are showing maybe symptoms of it. We have a place in mind of the prison of where to house them.
Mm-hmm. Do you have anybody that you've had to isolate?
Not at this point, no.
Okay.
So you haven't had no inmate or detainee at the Department of Corrections or Agotnia lockup has been tested for COVID-19, Major?
No, sir. And even in the test site, that test would not be at DOC's call. It would not, it would have to go through the medical process, and then the medical people would determine who gets tested and who doesn't get tested. That would not be our call.
Right.
And again, because of possibly the limited number of testing kits available, they all have to be screened, and if they meet certain category or criteria, then it'll be the call again of the medical.
And no one's came to DOC and said, I'm not feeling well. I need to be tested. I want to be tested. Have there been requests?
As far as I know, no. They do have we have a process, a sick call process in place where if the inmate does feel ill or needs to see a doctor, they can submit a request. But that's just for your normal medical issues. Now, we've already briefed our staff, and we've even let the inmates know that if they feel symptoms, they need to inform the staff as soon as possible, and then the staff will call the medical staff and respond accordingly to their protocols.
Major, have there, because I'm just going to be honest with you, there's a lot of anxiety I've heard from inmates and detainees of themselves, and I know that they've been in communication with the media, but what I was concerned about was repercussions. I was told that when the inmates and detainees reached out to the media and had kind of called you out for things that you had said, that there was repercussion for that, and that I don't know how it went down, but basically they had shared with us that they got chewed out, and they were told don't talk to the media. So is that a reality? I
mean, I'm not aware of anything of that nature, Chris. We're doing our part. We're getting the supplies, and yes, there is some frustration because we've had to cancel visitation, we've had to cancel incoming, we stopped all religious activities. We basically had to shelter in place. But what they're doing is no different than what everybody else is doing at home. Shelter in place. And that's what we're doing. And of course, some are upset about it. And, we do give them cleaning supplies. Of course, our supplies are not endless. So we have to maximize whatever supplies we do have to make sure that every unit is afforded some cleaning supplies and other items. We issue them government soap and government toothpaste. And it may not taste well, it tastes good, but that's what we have to do for now. I mean, they want their special soap and special shampoo, and there's a time for that, and right now it's not the time. So it's a lot of stress, but we are doing our best to ensure their safety and the staff. I mean, I've got calls from the families asking, when can we drop off incoming, and when can we do this? And I'm just saying, we just have to wait, get through this whole thing. And so right now, our prisoners are no different than what's going on in the community. We have to shelter in place and get through this.
All right. Well, thank you, Major Uggan.
I didn't mean to make you mad, Major.
No, I mean, it's part of I've been here 26 years.
I know.
This is part of it. I'm not immune to any of it, but we are doing the best we can, and we do, the director and the deputy director and the warden, they and myself included, we take all these concerns of these inmates seriously, and we do everything we can to rectify it. Of course, some are not happy, and we get that. We understand that. We're not going to make everybody happy about what's going on, but we're still, as of now, still COVID-free. Mm-hmm. And if this thing gets into our prison, like everyone said, it could wreak havoc on everything. Mm-hmm. Mainland prisons right now are having major issues. Mm-hmm. It's not funny. They're having major issues right now when it gets into their system, into their correctional facility. But we're doing everything we can to make sure it doesn't happen, and that's including, if we don't have to have somebody confined, then let them out.
Right.
Let them be out there, but. We're doing our best we can, and we are even considering. We have some masks that the director is looking at providing the inmates, at least as another precautionary. So we're going to be looking at that also.
Well, that's good, Major. I think, and it wasn't just the inmates and detainees. I'm getting those calls from the families too.
Yes, I understand.
Yeah. Is there any thought at all being given to maybe, obviously not the visitation, but the drops of things that the inmates are used to getting in normal times, or is that just such a logistical nightmare for you guys to have to deal with, setting up a process where people can drop things for
screen for contraband,
right, and all that? Yeah. So is that just never not going to happen during this COVID-19 time, or is there any kind of discussion or planning going into reopening that option?
Yeah, I won't say never, Chris. The director we have talked about it, about doing some sort of modified incoming schedule where certain items, mostly hygienic items, soap, shampoo, and things like that, would be allowed to come in. We do have a plan that we're working on. We just haven't finished all the details because, again, it's a very touchy issue. But the director does want to open up some sort of incoming as soon as possible, and we're working on it, but it's not finalized yet. So I won't say it won't happen. It will not happen throughout this COVID-19, but we just ask that they be patient with us. And again, all these restrictions in place are meant to also protect the inmate's family, right, from running around out there trying to find all these items, but also protect the inmates. So, the family members out there, that they could at least rest assured that we're trying everything we can to make sure they are kept safe.
Right. And that's what they want to hear. Right.
Major, when you take a look at the Theodore Roosevelt, you saw that the military, they went in and they immediately started to test everybody, and separate, those who tested negative from those who tested positive. Right. Do you foresee that, or is there any push to see to let that happen at DOC, where you test all the inmates and so who's positive, who's negative?
No, not at this point. Again, our testing, we take the guidance from the medical side on what needs to be done, and so we rely on their judgment and their to tell us what needs to be done. Because even on the Roosevelt, remember the Roosevelt, the issue is these guys are not criminals. They're not convicted of crimes, and so even if we tested people and we're going to move them, separate them from the non-tested, we have to be careful because of their crimes and crime partners, and where do you move them? You move them to another housing unit. I mean, if I have 3 people for assault and they're tested negative, and then I have someone with attempted murder, I mean, I cannot put them in the same housing unit or same area. Yeah. So we would have to have multiple areas to separate based on the testing, but also their offense. We would have to separate based on their offense, and do they get along with each other? Are they crime partners? Are they testifying against each other? We would have to take all these things into consideration if we start doing something like that. So, because we don't have no hotel to put them in, we can't separate them by hotels and things. So those will be issues, logistical issues we would have to work out if they decide to go that way. And again, right now, no one's showing symptoms, and so again, we're just taking our lead from public health.
Okay.
Right. Major, how about contraband? Is that still an issue? People throwing stuff over the fence line? Has there been a decrease since we're all supposed to be staying home?
Well, I mean, we've still had 1 or 2 attempt to throw things over. I'm optimistic that there's a decrease in it, but it's something that still is going to happen. It's because you still got people out there, and but.
So you guys caught somebody trying to throw over contraband?
Well, we didn't catch nobody.
No, not
per se, but
somebody, but the contraband.
We did find some contraband a couple of days ago, thrown in the back of the prison.
What was it?
And, you know what? I don't have the reports. It looked like Copenhagen and cigarettes and lighter.
Oh, not like hand sanitizer and surgical masks and.
No, no.
Toilet paper? They're throwing toilet paper over?
No, not yet. We still have a lot of that. So
okay, I'm just checking.
Drugs?
So it's just the typical stuff, you mean?
Yeah, it's typical. I can't recall any drugs, but I may be mistaken. But I know cigarettes and lighters and Copenhagen. I've seen they're trying to throw it over.
Okay. Major, we're getting some comments here. with all due respect, please urge mandatory testing, assurance of the community.
That's what I asked.
Yeah, I know. And also, there was a comment here. Thank you, Major, for the update for the public. And that's coming from a family member of someone who's behind bars over there.
Yeah, and you know, I'm always willing to answer any questions any family member has, and you know, try to assure them we're doing the best that we can. And if they need to reach out to me, they can always email me or call here at the director's office, and you know, I will talk to them. But again, the director and the deputy director and the upper management, we just want to ensure this thing doesn't get into our facility. We're really take this seriously, and we're really concerned. I mean, I got sleepless nights thinking if this thing gets in here, what are we going to do with the staff and the inmates? And it's terrifying. It's really scared to see what could happen. And so we just ask that the public and the inmates out there just be patient with us and shelter in place. And, you know, what you're doing, again, is no different than what your family is expected to do at home, or what most other people are. We're all basically on lockdown. You know, I just go to work and home. We don't even go anywhere. So we're all kind of basically on lockdown.
Yeah.
And just to work with us and be patient, and we will get through this and go back to some resemblance of normalcy shortly, as soon as we're able to get through this.
Major, I think that's important. I think people need to hear in so many ways with this COVID-19. They need to hear that you're concerned and that you're taking it seriously and that it's affecting you. And I think when they hear that, they kind of know that, you know, it humanizes it. And you know, you being, you know, one of the top dogs there at the prison, maybe they think, oh, he doesn't give a damn. But I mean, you're here telling us you do, and I can hear it in your voice.
Yeah, I mean, we really do. I mean, the director, like I said, when we have our meetings and stuff, it's never stressed enough that we have to protect the population. We have to protect the population. And again, it's even for our staff, we're really concerned about it.
Yeah. Well, thanks, Major Uggan. I just want to ask you, maybe later you can get me those numbers, though.
Yes, I will get, as soon as I can get my computer started. I will give you the numbers and email it to you.
And the results, hopefully, the remaining 7, I think you said, or 6, are okay.
The remaining what?
You said 13 were tested within the past 2 days. 7 were cleared to go back to work.
Right. So if we get more information, I will let you know. Okay. Right now, that's all the information we have, and then I will get you your numbers as far as the pretrial. How many were released, right?
Yeah.
Yeah, I broke it down last week, but I will need to update it and make sure I send you the correct data.
Okay.
Okay,
be safe.
Yeah, thank you, Major. Appreciate it, Major.
Okay, no problem. Anytime.
And we'll make it a lot of times. Okay, wash your hands, huh?
Yes, sir.
Okay, Major. There you go, Major Anton Uggan. And I just want to tell you why we're hearing from Major Anton Uggan instead of the director. Well, actually, I don't know why, but the director allows Anton to come and speak because, you know, let's just be real here. He's been there 26 years. Director Carbolito is kind of new on the job. So I actually appreciate that. You know, it's better than getting the director on who's going to, you know, we're going to look at that, or I don't know, you know. I'm not saying he doesn't know, but obviously, you know, Major Anton has a lot of institutional knowledge and
He's
experience.
He's been there for almost, what you said, three decades.
Yeah.
And it was good to hear from him because like you said, you could hear it in his voice, that he really does care about what's happening, and they're all trying their best and is asking for the community's patience because basically we are, like you said, we are all on lockdown.
Yeah.
So thanks, Major Uggan.
Yeah, we're going to take a break. It's 9:28, and as always, we try and end the show on a little light and positive note, and we're going to do that for you guys this morning. It's 9:28, containing COVID, the KUAM News Takeover, Guam's favorite good morning.
Join us in saluting
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. healthy. Be informed with ITD.
Howdy, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. I want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
We're working hard to keep you safe. Wash your hands. Stay home.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam. Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Do with Inner Voices. 9:35. You know, one of our reporters. Shout out to the whole KUAM family for really stepping up during this COVID-19 crisis. Let's bring Adriana Cotero On to the show now. Good morning, Adriana.
Good morning, Chris. Good morning, Bree.
Good morning.
Hi, how are you guys doing?
We're just doing COVID.
Yeah, I know.
You got off the phone with Frank Mansell of FEMA just a couple moments ago, right?
I had left a message with him yesterday, and he was returning my call because, as we reported, the U.S. Army Corps of Engineers, Honolulu District, with the Naval Facilities Engineering Command, Marianas, they're working together to assess 7 sites on Guam for these alternate care facilities. However, the U.S. Army Corps of Engineers, they can't be on foot due to, be here on island because of travel restrictions. So they're not here physically. So this is all in partnership with FEMA. So I was trying to get some, further information on these 7 sites and finding out what they were yesterday. So he was returning my phone call, and him and I just got off the phone like a minute ago. And Frank, his name's Frank Mansell, right? And he had told me that he couldn't tell me the names of the sites because they're it's still confidential. But we did see some photos, and just in speaking with Office of Civil Defense, Charles Estevez, he had mentioned that they were looking at a few of the different hotels on the island in Tumon, and then also the University of Guam Field House. So I don't know which site will ultimately be determined, but it is up to the government to decide on the selection. But Frank was saying that they're going to be giving them their report and their assessment by the end of this week. So he said that any further details would have to come from the government on their selection. But he was just mentioning that, these are for those beds, federal medical stations. And as of right now, there's 2 stocks of those beds on island. So that's making for a total of 100 on those beds. And whenever I had spoke with the Office of Civil Defense, Charles Estevez, he had mentioned that they were placed an order for another 50. So Frank didn't want to confirm that there's 150 on island, or because there's not 150 in total here just yet. But he did say that an order has been made, but he just didn't, we only have 100 on island as of right now.
Okay, and was that kind of the gist of your conversation? Is there anything else that you were able to glean?
For the most part, he was just saying that, when it comes to assessing these sites, that they really have to look at the safety of the environment, how accessible they are, and if there's going to be any modifications needed. So he was kind of just going through the different things that they look at. He didn't tell me, he wasn't able to tell me exactly, what site would ultimately be determined. But I know yesterday, whenever I had asked during the governor's daily press briefings, I had asked her about, an update on the medical supplies and also on these alternate care facilities. And she had mentioned, and I had thrown it into my story yesterday, that, while these sites are being assessed, what she prefers to have are medical tents. And these medical tents would be closer to GMH, closer to GRMC, and they would be inventoried to have bed capacity for those areas. And so I was kind of trying to ask him some questions about the medical tents, trying to see if FEMA was also in partnership with that. But and he said that it's a separate project, but it is something it's something simultaneously happening along with these alternate care facilities. But she had mentioned, Governor had mentioned that with those medical tents, they want to have close to 1,000 beds, is what she said in there. But I do know that when I had spoke with OCD, that they mentioned that the federal medical stations, that they need to be indoors. So that's why they were saying that the field house was ultimately was something that was a site that they were really looking at, because the beds have to be inside. So I wonder if these medical tents will be able to have these FMS beds as well.
Right. I heard something about the field house being considered as like an arena type option. I don't mean it because of the layout of it. That's what they call it. So.
Yeah, and they said that would fit up to 100 beds of these stations, just because of how much, the square footage that they need for them, all of them. So.
I also heard the governor talk yesterday a little bit about the DOD and the military setting up their field hospital, and that after, I think she said something that after they were done using it, that we would be able to not only use the facilities, but also to avail ourselves of the medical personnel that are involved in this DOD response locally for the Roosevelt.
Yeah, and I had asked that question, to Admiral Manoni earlier whenever he was at the press conference on Monday. because there is a lot of talk of, building up our healthcare workforce with their personnel, but it's after, and that's why I was trying to get to a little bit more clarification on it, because it's after their immediate response to their primary mission right now and their operations. And, they have 585 confirmed cases. So that operation could take some time for all we know. And that's why I was wondering what a more immediate response would be to our healthcare.
Yeah, I thought that was an interesting takeaway. Is that, when they're done with it, and then, we'll get to use it. So, but who knows how long that's going to be? I mean, this is. I don't think, at least in my mind, we've grasped the largeness of the Roosevelt and these 500 some positive cases.
And I think I even said in my question, I was like, and it's the numbers have climbed to an extreme number, and then Admiral Manoni had said, well, I wouldn't say extreme, but significant. And I was like, 585 is kind of an extreme number to me, but I don't know. I guess it's significant. But either way, regardless, I just think when it comes to any sort of crisis, which is I think with a lot of my questions in the press conference, I've been really trying to hit on how, preparedness, we need to just be prepared for worst case scenario at the end of the day.
Right.
As much as I hope it doesn't reach that, but it's just, you guys, everyone in the islands has experienced some sort of, natural disaster, typhoon, or what have you, and preparedness is key. It's good to be prepared.
You had a good question yesterday talking about expanding our capacity to store your dead bodies. That's a very sobering question that I thought, the governor's answers sometimes at these press conferences kind of a little all over the place, but I really felt that she was able to really speak to that question in a way that demonstrated the gravity of the situation.
Well, yeah, there was an answer to the question, so that's always good, when we get an answer to our question. So at that, and she provided some new information, which is, again, whenever we're covering anything like this, that's essential. So it's a hard topic to talk about, right? It's something people don't want to talk about, but it is unfortunately a reality right now.
Okay.
Yeah.
What are you working on, I guess, for today, Adriana? Or do we have any education news that you're tracking down? I know you had some yesterday about grab-and-go meals and lesson plans and stuff.
Yeah, it seems like they're having some, I saw a press release that they're doing some distributions now with, hard copies of lesson plans, because before it was just the online learning service programs that they were providing, but not everyone has access to being online. So they're going to start distributing some plans as well at their site. So that's something to follow on. And then I had an interview yesterday with PPE for Guam, and I know you guys spoke with Cyrus on the radio, but I had spoken with the co-founder of the organization, Allison Rutter, and so I'm going to finish writing up that story as well. And then, of course, covering the press conference in addition. But as far as grab and go for the lunches, I think that I had asked on Monday, I had asked GDOE on Monday for an update on how many meals, and they're doing about 24,000 daily, and that's for, 12,000, so it's breakfast and lunch, so 12,000 breakfast, 12,000 lunch meals daily right now, and they're still seeing an increase in demand.
Yeah, and Adriana, we haven't got to circle back to this, but people continue to call and ask about how they can apply for public assistance. Being as that's the only option that they have, and so people are still trying to figure out how to eat. I just got something here from Major Tom. While we're on the subject of people on our island trying to avoid going hungry, Major Tom from the Salvation Army gave me a report from yesterday. Beginning of day, 52 families scheduled appointments. 47 families are new to the program. 41 families have been affected by COVID-19. 251 individuals will be assisted by the end of the day. And then he also tacked on, this is really great, Major Tom, by the way, an end of day report. 46 families showed up for their appointments. 41 out of the 46 were new to the program. 36 of the 46 families have been affected by COVID-19. 224 out of 251 individuals have been assisted at the end of the day. A total of 22 50-pound bags were given out. A total of 46 families received a bag of vegetables, and one food delivery to a client was made. So, Salvation Army, he told us that they're continuing to see the demand increase. And you know what? It got to be, man. I teared up. And what he said that is something that's really hitting him in the heart as well, is that they're having to help these working class families who are the ones who usually donate and keep the Salvation Army's programs afloat. And so that really hit close to home for me, is when you have the people who usually help people in a position where they now need the help.
Yeah, I know. I mean, it's definitely, I think that it's something that I should also maybe during one of these press conferences, although, sometimes I wish we get more than 2 questions.
Yeah,
but,
that's kind of ridiculous.
It's something else I do want to touch on, because just what's, GDOE's grab and go, they have a total of, I think the last one was like 266,000 meals they've served within this month. And, during past press briefings, we've heard them mention federal aid coming and SNAP, but nothing locally. And we know that this grab and go program is going to end in about a month. And some people don't even meet the SNAP requirements at the end of the day. So there's got to be some sort of, I am hoping, or is there a plan for implement an additional or replacement local meal, like a mass feeding program of some sort? I mean, if those numbers from that speaks to something right there.
Yeah, and it's not the only program. There's also Catholic Social Services. Adriana, as far as I can tell, the governor's plan and telling everyone to hang in there is that, she's trying to wait for people to get the stimulus checks, and she's hoping that that's going to be enough and they're not going to revisit it. But I think that this is something, it's a bitter pill for me to swallow when these people who are trying to eat, who are facing this very real reality that I think our elected leaders are out of touch with. Yeah, it's hard for me when they're being told to hang in there, or, local assistance is food stamps, which is federally funded. That's not local. I mean, it's a local program. Anyway, it is what it is, and I'm still mad about it.
Well, I don't think you're the only one.
Yeah. And ask about it though, and see. I don't know. We'll see. But
I also want to give a little credit, because Linda, we talked to her yesterday, and they are kind of doing things and realizing this great need that people have and applying for the benefits. The biggest problem is that they can't run all over Guam trying to get all these documents, and so they did something with the mayors where Mayor's Council President Melissa Zavares has provided resources, so they're going to be doing the mayor's verifications directly, public health and the mayor's council. So that's good. And then also with some of these displaced workers, their applications, they can't get a verification of employment because, their businesses are closed down. And
that's why I think with DOL standing up their next phase of this unemployment program, these employers are going to have to file verifications and register with DOL, and that's at hireguam.com.
Right. And we did get more info from Dave on all the amounts and all that stuff. So we're going to be pushing that out to you guys. Adriana, thank you so much.
Thank you, guys.
All right.
Wash your hands.
Talk to you later.
You too.
Okay. Adriana Cotero from the KUAM news team. Did you have something there? Because I got to get our last call on the phone.
I can go over the numbers.
Right. Let's go over the numbers again. 949 COVID-19 numbers with Sabrina Salas-Mantanani.
Okay, so the number of confirmed cases of COVID-19 on Guam, this is from the Joint Information Center. This was released at 9:45 last night, and that's usually around the time that we get the latest updated results, just before, it's usually around 10 o'clock at night. According to the release, Public Health, they tested only 19 individuals for COVID-19 Wednesday. 0 tested positive. GMH, they're now being added into the mix of labs that are able to conduct tests for COVID. They tested 13 individuals, and again, 0 came up positive, which is good news. I also wanted to follow up on what Adriana was talking about, the Expeditionary Medical Support System. The U.S. Air Force engineers assigned to the 554th Red Horse Squadron, they're constructing an Expeditionary Medical Support System, or EMEDS, which consists of 3 25-bed capacity units within the fence line at Naval Hospital Guam. It's expected to be completed within the week. The extra beds and additional staff of 90 Air Force personnel will provide expanded capacity for U.S. Naval Hospital Guam, allowing an expansion up from 42 beds to 85 beds and from a 6-bed ICU to 24 beds. The project will not only support efforts to get the crew of the USS Theodore Roosevelt healthy and back out to sea, but will also give expanded ability to add GovGuam medical capacity. Also, the Seabees assigned to the Construction Battalion Maintenance Unit 3 are in the process of constructing an EMF, or an Expeditionary Medical Facility, on DoD property in South Finnegodson. This is a larger construction project which will result in a 150-bed capacity field hospital operated by over 400 personnel, with material offloaded from Naval Base Guam and site preparation already in progress. This project is expected to be completed in about 2 weeks. The EMF will provide expanded medical capabilities in support of DoD's COVID-19 response. DoD will be postured and well equipped to support the greater Guam community and the region if that request is made by the governor.
Okay, and like we always try to do, I mean, it's actually pretty easy to find people out there who are making a difference, because so many people have stepped up thoroughly, very thoroughly. The step up continues every day, every hour. And so we wanted to bring Chef Bertrand from the GCC culinary program onto the show. Good morning, Chef.
Morning, Chris. How are you?
Very good. I also have the lovely and talented Sabrina Salas Matanani here.
How
you do?
And so we wanted to talk about what you guys did for Catholic Social Services. Can you just walk us back to the beginning and how you guys have been working with CSS?
Actually, we started to do something with UOG, GCC Culinary, doing something with UOG. Every Wednesday, we're doing something for them. And then it happened, we kind of produced a little bit too much. So one of my colleagues who was with us said, I got a friend in the Catholic services. Maybe we could send our extra meal we produced to the Catholic. And we called them, and of course they were very happy. So we've been doing that for the last 2 weeks now.
Oh.
But mainly the thing was starting when Mrs. Okada asked us if we would be able to do something for the community. And most of my colleagues step in and say, yes, we can, yes. So we do something with UOG, and I think the meal go to the health department nurses. And I mean, we're not the only one who do that. A lot every day somebody else do it. We do it usually on Wednesday.
Oh, so you guys usually make donations on Wednesdays to these various organizations? Is it once a week?
Because we didn't want to throw away the food we had in our chiller, and when Mrs. Okada approached us, we said, yeah, of course we'll. And then they say, oh, use whatever you got, and when we come back in school, I will replace it. So that was no brainer. So five of my colleagues volunteer with me to go and cook.
So what kind of meals are we talking?
Oh, okay.
Sabrina's hungry, Chef.
Yeah, I mean, pretty basic. I mean, example, last week we did like chashu pork and fried rice. This week we sent some red beans and rice. I think the menu next week will be spaghetti bolognese or things like this. No?
So what? What'd you say?
Spaghetti bolognese.
Oh, spaghetti. Oh.
Spaghetti bolognese, yeah.
Yes. Or meat sauce, if you prefer.
Right, yeah. That's a little easier way to say it, Chef. Yeah.
I like that.
I mean, yes. Mm-hmm.
So how does it make you guys feel? And we're looking at the pictures here, and you guys have a great program over there. But what was the feeling here from you guys when you do this and you're able to give back to people who need it?
Oh, personally, I mean, I can probably talk for everybody. We feel very good, actually. We're not doctors and nurses, so we cannot help the hospital. So at least we can cook, so we can maybe help them a little bit. And if that help, great. It's staying at home all the time is not so exciting after a while, But if we can help the community, great. And with the support of our president there, because we were not allowed normally to go to the GCC kitchen, but she straight away gave us a green light, and we were glad.
You know, Chef, I think it's interesting in that, you know, a lot of people in the culinary program also work out in the hotels and the restaurants, and those people have been affected by COVID-19 and non-essential business closures and, you know, just hours reductions, in that a lot of restaurants have either closed completely or are only offering limited services. So is that what you hear from your students who are in the culinary program?
Yeah, most of them, yes. A few of them are still a little bit working, not full time, of course, but yeah, everybody is in the same boat. Unfortunately, even if we doing well with our side here, when it comes to the virus, our industry is the tourism, and if on the other side they don't do so well, we're not going to have the tourists for a while. So it doesn't look too good for the Guam so far, but Guam went through a lot of problem before, and they always come out okay. So it's some hope, no?
Yeah, and that's the note I want to end on there, Chef. Is that you're right? We have been through so many different things. You know, it's true we've never faced a pandemic of this magnitude before, but we have the power, Chef, and I know you know this, to kill that curve.
Mm-hmm.
Oh, definitely, yes.
Am I saying this? Am I saying this right? Restera à la maison.
Oh God.
So, pardon.
Rester à la maison.
Oh, rester à la maison. Oui, rester à la maison.
Yes. Did I say that right?
Yeah, yes. Your accent is a bit strong, but fine. Yes.
Yeah. Wow, Brie. Parlez-vous Francois?
What did I say? What did I say?
Français.
Restera à la maison.
Rester à la maison. Stay home.
Ah, right. There you go. Yes. You know, Bree's trilingual. She'll try any language.
Yeah. Oh, you were trying to see if I was really speaking French, no?
No, I just wanted to show off to Chris.
Right.
You know.
Yeah. Good job, Bree. Good job. Be a day. Okay, Chef.
Thank you for calling, and good luck. Carry on to do a good job.
Okay.
Thank you. You know,
we need all the support we can.
Mm-hmm. Well, thank you for what you guys are doing over there.
Yeah, definitely. And like I said yesterday, Chef, if, you know, a couple of those meals were to somehow get sidetracked and there was to be, you know, any type of curbside drop-off, totally adhering to the governor's social distancing orders, of course.
Yeah, I need to remind that to my colleagues because I'm getting old. My memory is kind of fading sometimes. But yes, I will. I'm sorry, sir.
Okay, Chef.
Okay.
Thank you. God
Thanks,
bless
Chef.
you. And I know you wash your hands, COVID-19 or not, all right?
Oh, yes. Actually, made better than before, even. Even me, I learned a little bit.
All right. Thank you, Chef.
Stay safe.
Bye-bye.
Au revoir.
Restera à la maison.
Oh, God.
Oui, je le sais.
Okay. Chef Bertrand from the GCC
That
Culinary
sounds so cool.
Academy. It does. You going to say it again?
Restera à la maison.
Yeah, she's going to be walking around saying this all day. I'm going to be tired of French by the end of the work. Hey, wow, it's been great, guys. As great as it can be. You know what I mean? Containing COVID. Thank you to our viewers on KUAM TV 11, our Facebook live stream, KUAM News. Remember, we got a lot going on news-wise. We're going to slam all these interviews out onto the YouTube. And we're working on a bunch of big things.
Yeah, don't forget 1 o'clock. We've got the press conference that we are broadcasting right here on 994, also on KUAM TV and live streaming.
There you go. And
That's
then, hey, heads up, we're doing our Stay Home Live Local Fridays tomorrow.
6:30 p.m. KUAM TV 8.
All right. Hey, for Sabrina Salas Mantonani, my name is Chris. Thank you again to all of our first responders, our frontline heroes out there. And I want to shout out again. I do this every Thursday. It's Trash Day. Shout out to the little guys who continue to hold this island up as we battle this COVID-19. Good job today, Bree.
Good job. Good job to all of the members of the media on Guam.
All right, let's leave you with some loyal migrants. Adios!
Resta a la maison.